All right, so good afternoon, everyone. Welcome back to our conference. This is panel 2 of the 4th School of Social Sciences Research Conference. So I'm Jessie Claudio from the Institute of Philippine Culture and the Department of Sociology and Anthropology, and I will be your moderator for this panel. So our panel's theme is Scalable and Sustainable COVID-19 Adaptations through the Lens of the Social Sciences. Before we begin, let me recap the house rules. If you encounter connection problems or get disconnected during the session, you may enter the conference room again by clicking the unique Zoom link sent to you via the conference registration confirmation email. Please ensure that your microphone is turned off during the conference to minimize background noise during the presentations. If your bandwidth allows, you are free to keep your camera turned on throughout the conference session. Please use the chat box on the right side of your screen for any comments or questions related to the session. These will be read during the Q&A portion. Participants will not be allowed to raise their hand and unmute during the Q&A session. And lastly, we value respect and courtesy the most in our conference session. So before we begin, please allow me to provide a brief description of the panel. We just share our presentation. Okay. Apologies, let me just. So again, our theme is Scalable and Sustainable COVID-19 Adaptations through the lens of the social sciences. Right, so hopefully you can see my screen already. COVID-19 disruptions wreaked havoc on the country's delivery of basic health services. Among those highly affected were the tuberculosis or TB and family planning or FP programs, as they experienced disruptions across different levels of service delivery. This panel explores the host of factors that characterize effective adaptations crafted in response to these disruptions experienced during the pandemic. It will detail how selected adaptations facilitated the continuous delivery of health services, albeit on a scaled-down basis, in spite of these identified disruptions. So 4 separate papers will discuss the initial evidence featuring these significant factors contributing to scalable and sustainable adaptations. All 4 papers are part of an IPC-led project entitled Joint Learning on Adaptations in the Era of COVID-19, funded by the USAID Clean Health Project. The project aimed to systematically document and assess the USAID Health Project's COVID-19 program adaptations to ensure continuity of essential health services across the continuum of care. Of particular importance to the research objectives are insights on what's working, lessons learned, and the timeliness of adjustments and adaptations to achieve project goals. So the project made use of a collaborative learning approach and relied on iterative learning processes to validate research findings through regular roundtable discussions and a webinar. The project was conducted over a 12-month period from March 2021 up to February 2022. The research employed primarily qualitative methods in gathering data on adaptive strategies, such as review of related policy and program documents and online key informant interviews and focus group discussions. As you can see on your screens, the team gathered data in selected study and comparison sites across NCR, Luzon, Visayas, Mindanao, and BAR. The study identified 4 factors contributing to scalable and sustainable adaptations, which will be the focus of the 4 papers this afternoon. The stepping up of technology use in service delivery, provision of supportive human resources, integration of various service components across different programs and health units, and lastly, supportive and consistent health governance policies across different levels of health service delivery. So let me remind the presenters that each presentation is limited to 15 minutes only. I'm instructed to inform speakers to wrap up on their final 2 minutes and stop the presentation should speakers go beyond the allotted time. After the last presentation, we will have a short Q&A segment. So we encourage everyone to send in their comments and questions related to the presentations via the chat box. So at this point, allow me to turn the virtual floor over to Mr. Joselito Sescon of the Institute of Philippine Culture and the Economics Department for the first presentation entitled Technology Use and Adaptation in TB and FP Services During the Pandemic. So Joey, you may now present your paper.
Thank you, Jessie. Good afternoon to everyone. So my presentation is about the technology use and adaptation in tuberculosis and family planning programs of the government as assisted by technical assistance by the USAID. So my objectives of the presentation is to identify and analyze technology-enabled processes adapted in TV and family planning programs during the pandemic. And then validate categories of technology-enabled COVID-19 adaptations as clustered in actual response, mitigation, and institutionalization. And recommend specific technology-enabled adaptations with corresponding social behavioral change practices, communications by health workers as sustained and delivered by LGUs and national government agency partners. So next slide, please. See, here I would like to pinpoint out that technologies are used during the pandemic, but as in essence, when you consider the health facilities and the LGUs, for example, rural health units, there's a flow there with regards to the flow of services from local government units and health facilities. But that's the kind of supply flow with regards to family planning services as well as tuberculosis program services. The other flow, of course, is that health patients and community members also have to go and demand for these services, which is to go to the health centers. And as all we know, these are very much affected. So in that sense, if you think about technologies, these technologies should help in mitigating these disruptions. The disrupted very much is the flow of patients as they stop going to the health centers, as well as the flow of the services wherein the local government units and the health facilities have difficult ways to reach the patients as well as to deliver the commodities, for example, medicines. And this at the top is, of course, the Department of Health, where they crafted the guidelines on how to deal with the pandemic, given that we have to continue the programs of family planning as well as tuberculosis programs. And there's the technical assistance of USAID, and there are civil society organizations, non-government organizations that help uh, in the implementation of the programs. They are there even during even pre-pandemic days. So next slide. Okay. So in general, what are the tuberculosis program adaptations? So the first that has to be done in adaptations is to craft a national TB control program adaptive plan. So uh, if you're not familiar, the tuberculosis program are organized in phases, no? Because it has to have first and foremost is active and intensified case finding to find patients. So there is already a computed number of potential TB patients in our population that is scientifically computed already, and they have to be identified. So the very first phase of the tuberculosis program is to find these patients. And you can imagine finding these patients, and in the active phase finding these patients wherein you have to deal as well with COVID. So that's the difficulty there. And that difficulty has to be guided well with a very good guidance from the national DOH, which is to, of course, through the document, the National TB Control Adaptive Plan. There you can see the integration of uh, integrated prevention during COVID-19, the integration of infection prevention and control as you uh, find TB patients, as you diagnose TB patients, and as you treat TB patients. So as you find them, how do you take care of yourself? How do you take care of the community as well as the patients, families, and so on? As you find them, as you diagnose them, and as you treat them. Okay. And then the remote mentoring sessions also disseminated because you have this document that is an adaptive plan, and how are they to be operationalized at the rural health unit level, at the health center level. And you cannot travel during the pandemic, during the strict lockdown in the first 3 to 4 months in 2020. So the best thing that they could do is to mentor by Zoom, by whatever they have, a platform they have in the integrated infection prevention and control IPC orientation, how to continue with the program dealing with COVID-19 also. And of course, the other one we're talking about technology is online platforms, dissemination, and migration to online training platforms. So the manual of operations on TB has to be done in a web-based training, and social media content for TB in new normal patient flow. So there's this how there's this patient flow you have identified already pre-pandemic, designed already on TB patients as well as uh, family planning clients. And you have to redesign this one considering integrated infection prevention and control due to the pandemic. So that's what we call patient flow management and health service delivery. So this demand and supply. And there are already components of that are being developed, like Fast Plus, which is on TB, find cases actively, separating safely, and treating them effectively. This is in the usually in a hospital setting. So as you know, the symptoms of TB and COVID have some similarities, and that's the difficulty in continuing the program. And there are guidelines, tools, materials integrating COVID-19. So as you screen the patients on TB, you screen them at the same time on COVID-19. And that's how difficult it is. You know? And the remote monitoring, mentoring, and coaching on introducing digital technologies on TB, which I will discuss later on the next slides. And the other adaptation that considers has is in the context of considering the technology that fits in is the change from the direct observation treatment of dots on TB into the delivery of TB services, or integrated delivery of TB services, or IDOTs, where TB patients, instead of being observed directly every day uh, on taking their medicine, this is on the treatment phase of TB patients. They are given 1 month supply of medicines, and then they're monitored uh, either online or by text and so on. So the next slide. And yes, the switch to longer time provisions, program adaptation. So when they switch to 1 month provision of medicine, well, before in the pre-pandemic, they encourage direct observation, wherein patients can go every day to the health centers and take their medicine. This is to make sure that they don't miss the TB medicine, because missing the TB patient, the medicine, and discontinuing it will become another problem, because it may become a drug resistant tuberculosis. So we have two kinds of tuberculosis: drug susceptible. They are TB that can be uh, treated with the usual TB tuberculosis drugs. And then the drug-resistant TB, where there are combination of drugs that has to be given to the patients, given that this kind of TB that they were infected, is drug-resistant. Okay, so this continuity of patients taking their medicine was very strict before, but during the pandemic, they encourage more this. We should trust our TB patients that they will take their drugs religiously. Uh, and so this was more enhanced or strengthened and encouraged during the pandemic, that you will be monitoring the patients as a health worker, monitoring the patients in not directly, and given them 1 month medicine. So, and it takes some behavioral change on the health workers, because this is a change in dealing with the patients. And of course, the LGUs have to have that's very crucial as well for LGUs to support the health workers during this time, because our health workers were into multitask, and they are adjusting because of the pandemic, and they are also tapped by the LGU in fighting COVID. Okay. Uh, okay. So next slide. I will be passed in the next slide. So these are some adaptations. Instead of for patients to come to the health centers, some health workers have to go around, have to uh, and then this has to be issued with a guideline on how to do house to house, and in open air, and so on. So that's one. No, health workers will not just do something when they are not guided by scientific ways of doing the new normal. Next slide. And this is an example, no, of new technologies. The new technologies such as e-plano, is pilot tested in Southern Luzon. It's an app. You suppose it links patients to service providers. There are few service providers enrolled in the system, but it's something new. But it because of the pandemic, most of these technologies even introduced are existing pre-pandemic. But during the pandemic, they got encouragement, or they get a push that these technologies can be piloted and be used. Okay, next slide. Okay, so the adaptations in family planning, they, as you know, that's a program of DOH, but the POPCOM also carried the Population Commission also has a mandate on family planning. But the DOH people, as well as the health workers and the RHUs, health centers, and LGUs, they are tapped also for against fighting COVID. The POPCOM personnel were not into COVID, but they were still continuing on the family planning program. They are mandated as well. So this helps a lot. And there are localized changes in human resource arrangement, the shifting of duty at the centers, vaccination time, especially during vaccination. The healthcare workers are, have to schedule themselves if they are in charge with family planning, if they're in charge with tuberculosis program, but they are also busy during vaccination, the last few months that we have. Okay. Okay, so tapping local and religious leaders, preference for long-acting FP methods were discouraged in Mindanao, the need for dynamic LGU support in the face of fluid online setup, and the unavailability of FP services and products is yeah, there are also problems when the delivery of commodities, family planning commodities, and there are so many of these. So during the pandemic, there were some areas they have difficulties in receiving this. So next slide. On TV, you have many. You have the integrated TV information system mobile app. Okay, and you have Light and Care TV. They are all under the NTV app suite of the DOH. They were there, but they were given a push more during the pandemic. Connect TV is an app for drug-resistant TB, and this was piloted in Rizal, Laguna, and in Caloocan City. And of course, I've mentioned already the web training on manual, web-enabled training on the manual operations for TB. As I've said, it has to be how do you do case finding, finding the patients, these TB patients, how do you diagnose them and confirm that they have or they don't have, and then how to treat them. And all of these are under the pandemic rules. Okay. And then the laboratory information system, interoperable. So if you have patients transferring from one place to another, moving from one province to another, that they can still be monitored. Intensified case finding activity using artificial intelligence in chest X-ray. So X-ray is one way of finding TB patients, but it has to be confirmed also in the laboratory in sputum test. Okay, and the active case finding use TB caravan with portable chest X-ray. So these are pre-pandemic, but they are given more push as you do. How can you find more TB patients? But imagine this, in all of the TB rules on how to do case finding the TB patients, that has to be integrated with COVID rules. So you cannot just screen TB patients for TB. You have to screen them at the same time whether they could be a COVID-19 patient. In that sense, if you are case finding on TB, automatically you are also case finding on COVID, which is a difficult thing to do because you have to get ready. Well, get ready as well that how do you how we will take care for those that you discovered have COVID-19. Uh, COVID-19 other than finding the TB patients. So next slide. And so what works for health workers, what works in terms of adaptation as well as on the technology, it has to be a clear purpose and the mitigation of associated risk in implementation. The associated risk really is on COVID-19 and flexibility of varying conditions, skills, knowledge. So you have health workers, you have health centers, you have rural health units that are geographically located in different locations, different geographic characteristics, different. There are cities, there are rural areas, and rules sometimes are not um, applicable from one place to another, and it has to have ease in use and implementation. So all these apps, if they are very difficult, the default of the health workers is to go to FB messengers, Vibers, and so Viber groups and so on. So that's you have to the technology have to compete with these social media online platforms to communicate. And the LGU support and appreciation is very, very crucial. And whatever you introduce as a technology or as an adaptation, it has to be aligned with national policies because health workers follow religiously the guidelines, manuals, etc. Because that's health science discipline, and they wouldn't thus do anything that without a proper guidance because that's how you do in health science. So next slide. And for FP and TB clients, yes, from the client's view, it has also to be have a clear purpose and mitigation of risk. So if you're going to the health center, so what are the things that are required? If you want to be screened for TB, what are the rules? And it has to be, assure you of the risk in the implementation. Again, also flexibility on locations. If you need to travel longer time or you want to be in the households only to be visited, depending on the situation in a place. Behavioral change, yes, correcting wrong perceptions and beliefs. Like, you don't, if you're having these symptoms, you don't want to be screened anymore because, you might be subjected for, for COVID, etc. All these things, no, they have to be assured. Ease and facility to follow the locator options, where you have to go and where you will go later on, so on, once you are confirmed or not confirmed, and so on. So LGU support and promotion is also very crucial in assuring the family planning and TB clients. Next slide. Okay. The recommendations is that national policies and guidelines on adaptation of specific health programs provided a direction. So if we ever always, we know what we had to do when we have a pandemic as per our experience. But on health, it's very crucial that once there's a threat of a disease, etc., an epidemic and so on, the guidelines has to be there very early because health workers will not just do it on their way without the proper guidance, the rules that has to be observed and so on, because this is a disease. It has to be scientifically based on how, just like how we have to wear our mask, how to have a distance, how much is the distance and so on, how close, how many people should be in the room and so on. No? So we have to have reconfiguration of health program implementation processes. COVID-19 become a whole of government approach, just like when you do active case finding, find TB patients, you have to to have other government agencies or other partners of government LGUs there to be present, because as I've said, as we observe, as you screen for TB patients, you're also screening automatically for COVID-19 patients. And the way that you have uh, to where they have to go, the when you say that patients has to go here and do it, then other partners or other workers, LGUs and so on, departments have to take care of them. Okay. The characteristics of innovations, adaptations, including technologies using the preparable guide that we are just show that initiatives that were more integrated, facilitative, process-oriented had more traction for adoption. So, as an end, what I can say is that there are technologies that were pushed, just like we know in our school we will adopt more online options in our classes because we get to use with the technology already. And same with family planning and tuberculosis program. These technologies, although as I've said, these apps, TB apps, and so on, and will have to compete with social media platforms. But as we will know more what apps will be adapted and what online learning, training, and so on will be more adapted in the new normal as the pandemic ends. Thank you very much.
All right, thank you so much, Sir Joey. So in the interest of time, allow me now to introduce our next presentation. Let me call on Dr. Dennis Batangan from the Institute of Philippine Culture. He will present the paper entitled Integration of Health Service Components, Pandemic and Post-Pandemic Scenarios. So Doc Dennis, you may now take the virtual floor.
Thank you. Thank you very much, Jesse. And thank you, Jesse and Joey, for providing the context of this panel, which is actually a series of presentations coming out from this particular study that Jesse presented. So, next slide, please. So the objectives of the presentation is to provide an overview of the health system context and changing health beliefs and models and institutional responses during the COVID pandemic. Again, this is part of the adaptation study that we have done in relation to the disruptions brought about the pandemic. Second would be to describe a framework for assessing adaptations in the context of COVID-19 disruptions, again coming from the same study, and analyze the evolving integration efforts as part of COVID-19 adaptations and systems transitions, which we actually provided as sort of recommendations for this study. Next, please. Just a brief context on the what was disrupted. Actually, we were in the process of implementing the universal health care when the pandemic struck. So this is the diagram from the Department of Health on the universal health care, which says every Filipino has access to quality, affordable health services when and where they need them without ever falling into financial hardship when these services are available. Next slide, please. The next slide actually shows the reform initiatives. Next, please. Yeah, reform initiatives on the local health systems under universal health care, which was also, in a sense, disrupted. Under the universal health care, now we will be moving into more local autonomy under province-wide and city-wide health systems, such that the implementation of local health systems will be under the jurisdiction, control, and management of the local chief executive. So what you see here are actually diagrammatic representations of the province-wide and city-wide health systems, for which you will note that the dotted lines from the central government going to the local governments. Next, please. Another major reform under the universal healthcare is the healthcare provider network. It's a very complicated diagram which shows actually how it is envisioned for Filipinos who are eligible under the universal healthcare law, meaning they should have health insurance coverage under PhilHealth, be able to access services either from public or private providers, and be able to avail as well of the other services that should be given to them from laboratories, X-rays, pharmacies, and be referred to higher level facilities. What you see on the left, no, in the cloud is actually these are the elements of the building blocks, no, building blocks of the health system, which should likewise be integrated and implemented in the local health systems. Again, these were disrupted. Preparations for this were disrupted because of the pandemic. Next. So this was already presented by Joey, in terms of how we looked at the different stakeholders, stakeholder entities in the adaptation process. Being a project-driven study, we had to look into the role of the USAID implementing partners, as it relates with the bigger system that we are looking into, composed of national government, local government, the facilities, and of course, the patients and communities where they are located. Next, please. Now, moving on to the disruptions that we saw in the study. Well, the diagram on the right, of course, this the more familiar social determinants of health framework that we have been using as well in our courses. The first item there is that this orientation is at the individual and institutional level. During the time of the pandemic, the institutions were grappling with solutions with technical approaches, but the individuals who were actually within the health system, and even us, outside the health, were also disoriented. There was a common fear, anxiety on what will happen, and if ever we get infected, what will happen to us, what will happen to our families. The second is, as this was happening, there was reconfiguration of health behaviors. So the health workers were making adjustments in terms of their service delivery processes. Individuals were also changing. We had to wear masks we had to maintain physical distancing, etc. Institutions were also confused on what to do. Will they open? Will they close? So that phase actually happened for quite some time, and that created also gaps also in the systems. And finally, there were displacements of other priorities and resources. During that particular process, health workers were pulled out and reassigned to some, the operations, for example, of health facilities became more and more, and some even purely COVID-oriented, to the detriment of the other health programs, which was still there. COVID was there, but the other health programs like NCD, malaria, TB, and the other programs on FP were still there. They did not appear during COVID. They were still there, but they were marginalized for some time because of the focus on the COVID responses. Next, please. The study, as we were looking at these different adaptations, disorientation, and changes, adopted a framework, which is presented in this particular slide. Now, what we have here is that on the left side, you have the assumptions in the context, reach stakeholders, including inputs and activities, which was supposedly what the health programs were doing during the pandemic. And then there was the COVID-19 disruptions, which we have already started discussing. And then the focus of the study is on collaborative learning. So what happened during these adaptations? What were the inputs provided by the partners? How these inputs affect the implementation of different programs? And of course, in that particular cycle of the inputs and the adaptations done, there is another cycle, yung back arrow, wherein there is supposedly adaptive learning, which provides additional inputs to so the one in the center with the square was the focus of the study. Yung outcomes hindi na yun ang focus na study. We didn't look into it because the study was only for 1 year. Again, next. Well, one of the diagrams that we actually were able to come up with in the studies, this particular diagram on the COVID learning, the 90 adaptations and systems transmissions. So integrating all of this, so if you look at from the extreme left, facing the screen, you have the COVID-19, pre-COVID-19 situation, of which we described already the UHC preparations, and then the disruptions, what we described earlier, disorientation, reconfiguration, and displacements. And then we have what we see here in the middle, no, in the dotted lines, is actually the focus of the study in terms of adaptations and innovations at different levels. No? This was happening simultaneously at the different levels. But you saw what you see on top of the preferable, which was already introduced by Joey, is actually part of the findings of the study in terms of emerging features of integration in integrated adaptations. The arrows, no, from show yung that this could move into more adaptive or integrated programs, or could move into the technology innovation system, especially the technology enabled items that Joey presented. And of course, on the right side, no, it has to actually merge again, to be integrated again into the overall governance setup of the country, taking into consideration the long COVID situation, the UHC implementation, of course, the 2022 elections, which we'll be having next month, the effect of the Mandanas-Garcia ruling, no, and further local, with the overall effect of further local autonomy of the evolving Philippine health system. So again, next. I think, the preferable, no, I won't go into the details, pero the emerging indicators of adaptations with better traction seems to be moving along these characteristics, with clear purpose, mitigation of risk, ease of use, supported by a national policy, flexibility and adaptation and appropriation of design, behavioral change, LGU support, and to address equity issues in these adaptation mechanisms. Next. The policy recommendations, I think this is the last slide in terms of the integration. Of course, there were national adaptive plans, no, that were mentioned also by Joey for TB and of course for FPARH. But these national adaptive plans needs to be integrated to the local health systems, to the local health plans, no. Otherwise, they remain a sort of separated, no, or from the local implementation process. There were other programs like the CBDR, no, Community-Based Drug Rehabilitation Program, which was also part of wherein the role definition between national and local government is still not clear, no? And so there should be more clarifications of these particular roles and more interaction between national and local governments and implementing units in terms of how to implement the community-based drug rehabilitation program. A further note on this is that we all know, no, that the community-based drug rehabilitation program in some areas is also associated with the Tokang phenomenon. So there is that kind of complication with regards to community-based drug rehabilitation program. The third point is the integration to the universal healthcare implementation process, because the universal healthcare implementation is actually envisioned and should be implemented to address not only the COVID-19 problem, but the overall health concerns, no, that the country has, no, even at the national and local levels. So this was disrupted, and there were delays actually in this integration process, and are just catching up actually at the moment after the cases became more manageable. And of course, to the last one related to what Joey presented, we should always be assessing or making reviewing, no, the health system delivery implications of the technological innovations, because the technological innovations can be very helpful, can be enhancing, but it might be introducing other concerns or other issues within the health system, especially in areas where there are possible gaps, no, in terms of technology adoption or technology support, or even willingness of people, no, to adapt these technologies. I think that's the last slide. Thank you very much for your time, and I'll turn back the virtual floor to Jessie.
Thank you, Doc Dennis. Let me now go to the third presentation. It is entitled Supportive Human Resources in TV and FD Services During the Pandemic. allow me to call Dr. Leslie Lopez of the Institute of Philippine Culture and the Development Studies program to present the paper.
Okay, thank you very much, Jessie. For full disclosure, Dr. Batangan and I, and also Jessie, are also with the Southeast Asian Studies program because we teach the comparative health policies in the ASEAN. So I will be talking about supportive human resources in TV and FP services. For disclaimer, although the description happened across all health services, I will just be focusing with the TB and FP services and to a certain degree, the adolescent reproductive health, because these are the programs that we focus in this USAID evaluation or learning evaluation that we did. Next slide, please. Yes. Okay. So there is a general perception that to be able to respond to the disruptions brought about by the COVID-19 pandemic, the priority should be on advanced technologies. Many people, including the bureaucrats, have this thinking. The use of various apps, as pointed earlier by my colleague, Professor Sescon, and the complete transition to online modality. However, as pointed out again by Professor Sescon and Batangan as well in their presentation, while COVID-19 spared no one, its variable impact was mitigated by the capacity of local government units to reduce and soften the effect of the disruption, specifically the effect on the health service workers, who are the backbone of health delivery systems. With that, the objectives of my presentation are as follows. Okay? To provide an overview of the human resource challenges faced by the health workers in the delivery of essential health services during the pandemic. Second is to describe some of the adaptations used by the health workers in providing these essential services within the context of COVID-19 pandemic. And number three, to identify potential health human resource adaptations for institutionalization to address possible future disruptions. Next slide, please. Okay. As was pointed out by Dr. Batangan, we followed a framing of collaborative learning and adaptation. So in the slide that he used, there is actually a recursive arrow. And my attempt this afternoon is to provide or flesh out the initial points that were already raised by my colleagues by focusing specifically on the human resource angle. So what are the major disruptions that were identified? Many of the local government units that we talked with really were at a loss, as pointed out earlier, at the onset of the lockdown. There is the order to lock down everything, every single thing, but no clear guidelines on how to provide essential health services. As the lockdown was eased, the local health executives were still at a loss on how to proceed. The confusion was somehow alleviated when the IATF, as well as the Department of Health, came up with policies on how the health workers can slowly ease back to work. Some examples that were already pointed out, example is the DOH Department Memorandum on Interim Guidelines on the Continuous Provision of Maternal Health, and to a certain degree, discussed extensively by Professor Sescon, the National TB Control Program Adaptive Plan. This allowed many local government units to craft their local guidelines to provide these essential services. As the lockdown restrictions were slowly removed, local chief executives provided a number of incentives to their health workers to return to work. For example, there was this meal allowance, free boarding and lodging, aside from the COVID-19 SRA special release allowance that was later on implemented at the national level. As very little is known about COVID-19, being available during the first few months of 2020, one of the biggest deterrents for the health workers was the fear of acquiring the disease and passing it to their respective family members. Based on the series of interviews we had with health workers from across the country, there was no national policy to respond to this concern. However, the perception of many health workers that the LGUs have their back encouraged them to continue working. Next slide, please. Many health workers recognize the need to transition to an online modality, but this needs to be done on a more staggered and area-specific basis. Some geographically isolated and disadvantaged areas do not have stable internet connections, making this transition difficult, if not entirely impossible. Some health workers have limited computer literacy, and this presents an additional burden for them to play catch up from the usual health services that they are expected to deliver. The transition to new technologies and apps requires constant coaching and mentoring, a point succinctly pointed out by Professor Sasquan a while ago. Even the guidelines required some level of interpretation, for example, the National TB Adaptive Plan. Many frontliners find the coaching and mentoring inadequate, and they are unsure about their interpretation of some of these national policies. Meanwhile, the training is also happening side by side with the routine health delivery functions, making it difficult for many health workers to focus on the training activity. For some services, the health workers recognize the need for more personalized touch, such as the counseling services that are integral part of the family planning and adolescent reproductive health services, as was mentioned also by Professor Sescon. Next slide, please. So what are some of the solutions that were adopted by the health workers? What many fail to realize is that the online transitions also entails additional costs for the health workers. While some TB and FP apps were rolled out eventually or were continued to be used by the DOH, the absence of stable internet in many areas requires additional work for the health workers on how to find ways to submit the reports online. Also mentions the need to learn and transition to a new template and format. That is bullet point number 2. Okay? One fascinating human resource adaptation is the use of FP chat groups to overcome these limitations. The chat groups serve as a platform for several things. For example, a source to borrow FP or even TB paraphernalia, because there were indeed some stockouts that happened during the early part of the pandemic. And the overall support system for challenges faced by the health workers when as they encounter in their day's work. Many health workers also use the FB instant messaging feature to connect with their clients. However, the costs of going online are mainly shouldered by the health workers as no internet subsidy was provided. Given the additional vaccination duties that they are expected to do, on top of the quarantine policies implemented by the LGUs, the health workers devised a way of managing their activities, as pointed out in the first bullet, of managing their activities. Specific days were designated for vaccination duties, while other days were for essential health services at the health center. When asked if these are the guidelines of the DOH, the health workers candidly admitted that they thought of this arrangement because it is impossible to manage all of the assigned tasks. Some LTUs, the ones with the resources, were able to hire additional staff to augment their overworked health workers. Some of the TB and FP apps that are being used or were piloted during the migration to online modality are designed to streamline the work of the health workers. However, there is an unintended effect of creating another layer of work. For example, the integrated TB information system, the encoding functions are definitely add on to the health workers. While the ePlano, which was illustrated by Professor Sescon, while having a very attractive platform, still has very limited takers. This is for the software engineers, not our team, to address. Definitely a more human integrated design is needed for such technologies. Next slide, please. As I hinted earlier, a more contextualized approach was applied by the health workers in the BARM, where barangay health workers did a lot of house-to-house client calls and counseling proved effective for the continuance of the TB and FP program. This strategy was also used in the expanded or the integrated DOTS program because many of the TB patients were hesitant, okay, or refrain from securing their TB medication from the health center. Thus, the BHW stepped up to fill in the gap. Okay. With these observations, the study looks at the possible areas for improvement. Okay. Next slide, please. There are already existing disaster mitigation plans and structures that sadly were not activated in the last 2.5 or 3 years. For example, the Dream Team that is available in every single LGUs. There is also an NDRRMC, which we tend to always equate with just flooding, earthquake, and typhoons, but actually is also supposedly equipped to respond to other forms of disasters. At the same time, okay, there are a lot of lessons that have been gained over the previous 2.5 years. These existing plans can be revisited so that the health delivery system, specifically the health workers, can be provided with clearer and more realistic guidelines on how to proceed with their work in the next massive disruption, hopefully not anytime soon. Okay? As I also hinted earlier, there is a learning curve in everything. The transition to online modality, to a certain extent, has been partly achieved during the COVID-19 lockdown. Thus, regular refresher courses and institutionalizing the existing online systems that proved effective during the latter part of our response to COVID-19 should not be forgotten. So there should be a refresher course done not only at the national, but also at the LGUs with sufficient resources to do online modalities. As I pointed out earlier, this is not a blanket solution to all the LGUs across the land. Meanwhile, for LGUs with scarcer resources, alternative systems of health delivery system should be continued with or without a pandemic. This would minimize disruptions in future emergencies. So for example, if Bandilio or the regular recurring visit of BHWs in BARM prove effective in BARM areas, then this should be institutionalized and strengthened, supported, so that it would be integral part of the health delivery system. Also, as the backbone of health delivery services, a stronger emphasis on the mental health concerns, anxiety, even PTSD of health workers should be given more attention. We know that these things exist. We know that they are dealing with so many things. They're given SRA, but to have a more institutional response, this is something that we're lacking in the interviews we had with the health workers across the land. As part of recommendations 1, 2, and 3, okay, while the resources will always be limited, for these first 3 recommendations to really apply, there has to be a resource, like for example, integral in the budgeting of the LGUs and the national level, so that whatever is needed is allocated, okay, and provided for, as I said, both at the national as well as at the local level. So thank you very much. And with that, I would like to end my short presentation. Good afternoon, everyone.
Thank you very much, Doc Les. And now we go to the last paper in our panel. It's entitled Health Governance Policies and TB and FP Services During the Pandemic. So let me now call on Dr. Pilar Berse, who will share her screen. Dr. Pilar.
Okay. Magandang hapon sa inyong lahat. So I'll be sharing my screen, but there are 2 people in my group. It's a team effort between me and Mr. Vincent Carlo Ligara, but I'll be the one to share the screen. Do I have the function to do that? Yes?
Yes.
Okay, sige.
Yes.
Hang on. This will stop other screen sharing. Do I want to continue? I want, right?
Yes po.
Okay, sige. All right. Okay, Vincent, the floor is yours.
Yes po, yeah, you can see.
Oh, hang on.
Yung slide po.
Okay, there you go.
Sige. So, good afternoon po ulit. We are Dr. Pilar Berce and Vincent Igara from the Department of Political Science. We are presenting paper number 4 under the Scalable and Sustainable COVID-19 Adaptations panel with the title Health Governance Policies, TB and FP Services During the Pandemic. It is a policy analysis on selected policy issuances on COVID-19, mostly from the IATF EID as well as from LGUs. This paper was born out of the need to confront the issues that the national government is currently facing on how to move forward with existing health programs given the compounding effects of the pandemic. Let's go to the next slide. So ito po yung mga objectives ng presentation namin. So the first one is to present existing national and local laws and policies in place regarding tuberculosis and family planning here in the Philippines. The second objective is to examine select COVID-19 IATF policy issuances vis-a-vis these national and local laws and policies. The third objective is to show existing and possible tension points that may arise, as well as their effects. And last but not the least, our fourth objective is to provide some recommendations moving forward. Next slide, please. Now, the COVID-19 pandemic has created unprecedented challenges to the Philippine healthcare sector, particularly on existing health programs under some of the country's most pressing concerns, namely tuberculosis and family planning. The Philippines ranks the highest in terms of TB incidence among Asian countries, with 554 cases per 100,000 Filipinos. As such, it is viewed as a public health concern that necessitates the involvement of multiple sectors along the lines of research, public health training, proactive treatment mechanisms, as well as national and international information exchange channels to curb the disease's spread. Family planning, on the other hand, has always been a significant health concern, with high population growth identified as one of the causes of poverty and inequality, as it threatens to contribute in pushing millions of Filipinos deeper into poverty. As the UN Population Fund notes, the dynamic of population trends is heavily linked to prospects of poverty reduction, sustainable development, in the country's overall growth. As such, this research seeks to interrogate tension points at both national and local levels between existing tuberculosis and family planning programs vis-a-vis selected IATF policies meant to address COVID-19 related problems. Next slide, please. So currently, for our national TB policies, there are two major existing legislations, RA 1136 and RA 10767. Let's go with the former first. Now, RA 1136 seeks to strengthen the country's healthcare infrastructure by establishing dedicated TB units. These include well-equipped, fully manned provincial TB centers offering free services, TB wards in provincial hospitals, mobile X-ray units in far-flung rural areas, quote-unquote village rest settlements for TB patients for them to recuperate and recover, and last but not the least, the establishment of the National Tuberculosis Center. Next slide, please. However, we also have a more recent legislation, which is RA 10767, or better known as the Comprehensive TB Elimination Plan Act, which presupposes the creation of a comprehensive Philippine Plan of Action consisting of national TB targets and strategies, national response mechanisms such as prevention, diagnosis, treatment, and care, the development and application of crucial technology in addressing tuberculosis, reinforcing local, national, and international partnerships, as well as reaching out for new collaborations in education, advocacy, as well as in research and funding, the creation of a TB review and monitoring system, as well as the formulation of procedures for the swift mobilization of anti-tuberculosis services in the wake of either natural or man-made disasters. More importantly, under this Republic Act, DOH committees and institutions are to be strengthened through capacity building, through the provision of free laboratory services and stable medicine supply in local health centers, the incorporation of TB education and resources in all education levels, a mass media TB campaign, regulations on the sale and consumption of TB drugs, and the expansion of PhilHealth's TB benefit package. Next slide. For family planning naman, on the other hand, we also note two existing legislations, although there are more. of course. The first one would be RA 6365, or better known as the Population Act of 1971, which created the Commission on Population, better known as POPCOM, with the following functions. I listed down the notable ones. So the first one is to formulate and adopt, syempre, long-term comprehensive strategies, programs, and policy recommendations on population as something intertwined with economic and social development. Under this Republic Act, FP clinics are also to be formally established in collaboration with the DOH. POPCOM is also tasked to conduct, promote, and publish research related to the Philippine population, as well as to gather and disseminate scientific data and technical know-how on medical, social, cultural, and economic occurrences. For accountability and transparency purposes, POPCOM is required to submit annual reports to the Chief Executive and to Congress on its calendar of activities. Next slide, please. Syempre, if we go even more recent, diba, we also have RA 10354, or better known as the Responsible Parenthood and Reproductive Health Act of 2012. Under this Republic Act, LGUs are called to 1. Hire skilled health professionals for maternal health care and skilled birth attendants for an optimal professional-patient ratio, and 2. Augment their healthcare capacities to be able to provide emergency obstetric and newborn care. Under this RA, there's also the provision of a wide range of modern family planning methods by accredited public healthcare facilities. No Filipino is to be refused information and access to both natural and artificial family planning services. This, of course, excludes minors who do not have the written consent of their parents or guardians, unless if the minor has suffered a miscarriage or if the minor is already a parent. Lastly, under this Republic Act, LGUs and public health actors are required to conduct a yearly maternal death review as well as a fetal and infant death review. Next slide, please. Of course, there have been numerous local level initiatives done to address tuberculosis and family planning. For TB, these include the annual allocation and disbursement of TB-related services and equipment, the formation of LGU and barangay level TB task forces, the establishment of a TB referral process, as mentioned also earlier, the imposition of local fines and penalties, as well as the strengthening of multi-sectoral partnerships between LGUs and the private sector. For family planning naman, we noted 2 examples, so Quezon City and Makati City. So for Quezon City, there has been a ban on home births, prohibition on untrained birth attendants from delivering babies, as well as the city requiring health professionals to deliver babies only in health facilities. They also formulated an Adolescent Health and Development Program, or AHDP, as well as the establishment of the AHDP Council to create safe spaces for adolescents seeking the family planning education and resources that they need. For Makati City naman, they launched via the Makati Social Welfare Department, or MSWD, online pre-marriage counseling services for couples applying for marriage licenses. Surely there are more, but at this point, I would like now to pass the mic to Dr. Bersa.
Thank you very much for your presentation, James. So can I be heard now? Can I be heard? Okay. So to continue, our paper identifies 2 specific IATF policies on COVID-19, particularly on mobility and community quarantine. So for mobility policy issuances, we singled out IATF Resolution number 11 as it stood out because it sought to suspend non-essential travel to and from Metro Manila from March to April 2020. Specifically March 15 to April 14, 2020. This particular issuance was imposed in keeping with the government's effort to contain the virus from spreading like wildfire, which comes from the movement of people within their place of residence in the local government area or unit to other LGUs where work is to be found. So this particular issuance is compounded by restrictions on the use of public transportation in the NCR or National Capital Region. The relevant to IATF Resolution number 11, by May 2020, the DOTR released its guidelines in managing public transportation within NCR during the quarantine. This particular issuance basically suspended various modes of transportations, including provincial buses, PUGs, UV Express within NCR, even passenger vessels to and from Metro Manila. Restrictions were likewise imposed on bookings using ride-sharing apps like GrabShare, Angkas, and Joyride. With regard to community quarantine, so on May 22, 2020, the IATF released a policy issuance, specifically an omnibus guidelines on the implementation of community quarantines in the Philippines. This particular set of guidelines even provided specific provisions on interzonal and intrazonal movement of people, goods, transportation, and other essentials. The months that follow, this would be between the months of April, May, June, July, saw a lot of areas, specifically in Metro Manila, deal with different gradations of community quarantine, such as enhanced community quarantine, modified enhanced community quarantine, modified general community quarantine, among others. The variations are really quite diverse, but they all point out to different restrictions on people and their movements. The policy issuance on community quarantines compelled both public and private offices to adjust to the guidelines concerning operational capacity and the implementation thereof of a skeleton workforce. So at the onset of the pandemic, many government agencies shifted to doing work remotely or via skeleton workforce. And I think this continued well into the first 2 years of the pandemic in 2020 and 2021, therefore overwhelming some agencies and affecting the delivery of basic services to the general public. From these policy issuances, we identified tension points that dramatically affected people's mobility and access to basic services, particularly during the height of the pandemic, when COVID cases were at its peak and vaccines were either not yet being procured, or if they were already procured, not yet aggressively rolled out. So this particular tension created an unparalleled problem among those who are dependent on public transportation for their mobility. The Luzon-wide transport ban particularly hurt the poor, who are heavily dependent on the use of public transportation. For TB patients, access to both medication and healthcare at many points during the community quarantines and lockdowns became limited, particularly in Metro Manila, and it affected required screening of presumptive TB patients. At the height of the pandemic, mobility restrictions affected both those requiring access to birth control and family planning services and the healthcare providers at the LGU or barangay level, therefore disrupting various cares provided under the family health and planning program. On community quarantines, this particular tension point took its toll on Metro Manila's urban poor communities. On one hand, you have daily wage earners who, under a high-risk quarantine classification, had restricted to zero movement from their place of residence to their place of work. Now, this is a big deal, especially for those who are living below poverty line and who live on a hand-to-mouth basis, because this basically translates to zero movement from their place of residence to their place of work, translates to zero income. On the other hand, you have vulnerable sectors, including TB patients, who require healthcare and a steady source of income to sustain a healthy lifestyle, reliable access to medicines, laboratory tests, and access to medical practitioners. Now, in the course of our research, we came across some unexpected tension points that we thought would benefit the readers of our paper or who will encounter our paper, as it tried to tackle or touch on points regarding infrastructure, facilities, healthcare system. We singled out 2 points here. The Philippines' approach in fighting TB or tuberculosis rests on proper diagnosis, treatment, research, funding, and aggressive monitoring of cases, among other mechanisms. Without a dedicated facility to do COVID testing or COVID-19 testing exclusively, co-sharing limited laboratories and testing facilities with TB-related problems having to be accommodated, it therefore exposes the country's weaknesses or current weaknesses with regard to our health infrastructure and facilities. So that is one unexpected tension point. With regard to family planning, a 2020 study conducted by the University of the Philippines Population Institute and the UNFPA, or Population Fund, showed that the pandemic also disrupted maternal and newborn healthcare services worldwide. These indirectly, or the indirect effects may contribute to increasing annual maternal deaths and unplanned pregnancies. Having identified the tension points where COVID policy issuances and health programs as they exist now on tuberculosis and family planning intersect. Having identified that, we've arrived at a few policy recommendations. In the context of tension points for the country's fight against TB, vis-a-vis its COVID-related policies, we identified the following: increased manpower and organizational capability of various health offices and facilities to reach out to patients whose mobility are most likely to be affected by community quarantine or granular lockdown or any similar permutation in the event of another pandemic. We also note that it's important to capacitate rural health offices that are closer to the communities to deliver medications and administer injections to TB patients to address mobility concerns during lockdowns, a problem which affected more than 50 million people in Metro Manila alone. We also thought to point out that it's important to establish a dedicated facility for epidemics such as COVID-19 or SARS to keep TB testing laboratories and the facilities of the NTC for exclusive use of the tuberculosis patients only. It's important also to note that investing in mobile laboratories that could be deployed to collect sputums or samples from patients when people's mobility is restricted can very well serve the community. This is to ensure that regular screening targets are achieved and patients that require care are identified and provided proper medication. In the context of the country's fight against TB, more on this, we also identified the need to provide a community-based source of livelihood within urban poor communities to increase employment and have a more sustainable source of income within the community. Lastly, or at least 2 more points, increase government capacity through funding in providing basic necessities for the quarantined population. This would include medicine, food supplies. And lastly, for TB, institutionalize healthcare protocols for vulnerable sectors in the event of another epidemic or pandemic. Some recommendations for tuberculosis are shared with family planning health program, but below are those that categorically or are categorically useful for family planning. First, the government needs to explore more effective ways of rolling out comprehensive sex education as part of their public awareness campaign. It's also important that the government looks closely at the other factors that contribute to the declining population growth rate in the Philippines and see whether this trend will continue post-COVID-19 pandemic. Now, these policy recommendations, while they're not exhaustive, provide some basis for policymakers and other stakeholders on which existing policies on tuberculosis and family planning can be revisited or reconsidered moving forward as we confront the challenges of providing effective, efficient, equitable, responsive, and of course, keeping with the theme of our conference or our panel, sustainable and scalable adaptations with regard to health services to the people. So that ends our presentation. And since we're paper number 4, that also ends our panel on scalable and sustainable COVID-19 adaptations. On behalf of my teammate here, Vincent Ligara, thank you very much for your time. Magandang hapon po.
Thank you very much, Doc Pilar and Vincent. May we call on, may we ask Doc Dennis, Ma'am Leslie, Sir Joey to also open their cameras for the open forum. So we received a few questions via direct message here on Zoom. But for our participants in the room right now, we're still open. No? You can still send in your comments and questions via the chat box. No? So maybe we can get the ball rolling with our first question. And maybe this is directed or can be addressed by either Dr. Leslie or Sir Joey. Were the findings in terms of TB and FT adaptations similar between the study sites and the comparison sites? And then because you mentioned USAID, how attributable are the adaptations to USAID? So maybe Ma'am Les or Sir Joey, would you like to address the question?
Yes, sorry ha, natanggal yung aking Bluetooth na headphones.
Yes,
Can you repeat it one quickly lang?
Okay po, sige po. So the question is, were the findings similar between the study and comparison sites? And because we mentioned USAID, how attributable are the adaptations to, or the success of the adaptations to USAID?
Yeah, okay. That's very good question. There's no, well, the way I look at the narratives that I shared with regards to the human resources side, there's no palpable difference between the adaptations that we observe in the comparison sites and the project sites. And with regard to the question, so what is what stood out actually is that the need to have the LGU support, because ultimately the rolling out of the vaccines, the rolling out of these health services are all done at the local level. So that is the very stark finding that we are claiming both at the human resource side and as well as the technology adaptation side. But I'm sure Joey would have something to add later on. And with regard to attribution, whether it's a USAID intervention, we don't have control mechanisms at this point to say that it is attributable to USAID. What is, however, palpable is that in sites that has the PAPCOM and PAPCOM work closely with the DOH as well as the USAID, there is not as much as stuck out in terms of family planning paraphernalia, because the PAPCOM as well as the USAID counterpart, which is Reach Health, provided for these things either directly or indirectly when they do their respective monitoring visits. Joey, I'll pass it on to you. Thank you.
Thanks, Ma'am Les. Go, Sir Joey.
Thank you, Leslie. With regard to the comparison sites, with regards to strict comparison, the reason that we can say there's no palpable difference, there are differences, but the attribution of the difference, it appears like it falls on the LGU support. So there are differences, but you cannot say that this is because there's no USAID here and there's USAID here on the other side. But rather, the difference is very much determinants of the differences, very strong on the LGU. So if the LGU provided the support, provided this facilitation, so on, it makes a lot of difference. More than the presence, or this is something really also very, something that the study have not, well, we categorically recognize it, but we are kind of, should we put that as a, because it's not because there's USAID there or here, the knowledge of USAID can be well disseminated. If they help make a rule or a document, let's say, a lot of them have technical inputs into the formulation of the National TB Adaptive Plan, into the integrated prevention and control guidelines, the laboratory guidelines of detecting and so on. So they have, and the dissemination and diffusion of this knowledge is not constrained, no? Whether as far as our comparison sites, kasi lahat yun because all of them are under DOH and so on. So even if there's no USAID, this knowledge, technical assistance of USAID can well percolate, can well reach out to these comparison sites, no? So that's the difficulty of having the comparison site. We thought that we can have something there, but what emerges actually more as a determinant of a success of an adaptation or not of technology as well is the very crucial one is the support of the LGUs. Of course, provided that there are the guidelines already that from the national so on were already there, which were inputted already also by USAID support. And yung second question, Jessie, na no, kalimutan ko sa medyo.
Yeah, the question po is, we're finding similar between study and comparison sites, and how attributable are the adaptations to USD?
Yeah, I think I answered the question right
Yes.
there. Thank you.
In summary, Sir Joey and Ma'am Les, what actually made the difference was the LGU support and the policy support of the adaptations, not necessarily the presence of USAID technical assistance, at least based on the data.
To clarify, the assistance mattered, no? But you know, it's there, can be tapped by, can be replicated even without the USAID support, no? It can be replicated even without USAID there. So dahil libre naman yung yung knowledge unless yung equipment yan, no? But if the LGU can also afford that equipment, they can buy that equipment. No?
And I think maybe just to add, no, because you mentioned po, Sir Joey, that USAID technical assistance isn't just in terms of service delivery, but also in terms of drafting the adaptive plans of the TB and FP program. So maybe that's also why they also have buy-in in terms of policy, because they know that any technical assistance wouldn't push through without the support of the LGU, of the national government.
Yeah. Jessie, if I may just lead you back to our preferable framework, that is actually the basis of the framework, the preferable framework. We emphasize the LGU buy-in, which is integrated into the framework in the succeeding round of evaluating adaptation to disruption. What is critical is really the LGU support. And as far as from the human resource side, what is interesting to note is the creativity of the health workers with or without the USAID support. They step up to the occasion because it's a make or break situation without ignoring that there are palpable human costs, emotional costs on the side of the health workers. Thank you.
Thanks, Ma'am Les. So maybe we can move on to the next question, and maybe this can be answered by Doc Pilar and Vincent, our colleagues from the political sciences. Another thing that was mentioned during the presentations was the impact or the potential impact of the 2022 election. So in terms of health policy implementation in TB and FP, meron po ba kayong like insights or maybe possible reflections on how the 2022 elections, the candidates that are running right now in the national level or in the local level, kung paano po maapektuhan yung ating implementation ng health policy in TB and in FP. So medyo may pagka-forecasting po yung yung tanong ano po. But yun po, no? So ano po kaya yung magiging impact ng 2020? Kasi po relevant, diba? 2020 election.
Okay, maybe I can start. Vincent, no? Mauna na ako. Thank you very much for that question. Kung kanino man nanggaling yun, Jessie. It's really a relevant question and pwede naman talaga natin isama dun sa presentation namin on health policies on tuberculosis and family planning. I think to answer it in a very straightforward manner, the way it will be, I think it's very important that we look at the platform of our candidates. It's because based on our research, no, Jessie, tuberculosis must be met aggressively. Alam mo yan, meron talaga tayong standard na sinusundan. That's why it was very problematic for health practitioners behind combating tuberculosis during the first 2 years of the pandemic because they had to share the facilities when wala pa tayong kakayahan, no, na mag-test aggressively ng mga COVID cases. And those delays contributed greatly impacted greatly in a negative way the way we try to address or stay committed to our dedication in combating TB. So our approach is aggressive and it should be nonstop. So with that in mind, I think it's important to look at candidates who will approach these specific health problems in a very scientific manner. Hindi pwede yung mga lip service na aalagaan namin kayo, bibigyan namin kayo ng tulong sa inyong kalusugan and all. It has to be very, very precise. Ano ang plano? Because we're coming off hindi pa nga tayo talaga fully magka-come off kasi di ba tuloy-tuloy naman ang pandemic. Nagkataon lang na meron na tayong mga vaccines and all that. But what do we do, no? Moving forward, ano ang plano ng mga uupo sa gobyerno in say for example, establishing centers that can conduct sophisticated research relevant to pandemic or other diseases. So yun yung kinakailangan nating bantayan. Unfortunately, sabi mo nga, para tayo nagpe-predict. Unfortunately, I'm kind of on the lookout, no? Naghahanap ako ng madalang siyang mabanggit sa mga debate na napapanood natin. Hindi siya masyadong lumilitaw. Ano ang plano? Meron ba kayong specific na center in mind na itatayo kagaya ng meron ng Taiwan? Pagputok ng pandemic, Taiwan has this 100+ step na pwede nilang gawin. Ano yung unang-unang gagawin at the start of the pandemic? They have that. Tayo ba, may balak ba yung mga kandidato to establish such scientific and sophisticated protocols so that, moving forward, we are more adept, we are more capable in dealing with similar diseases of such great proportion. I hope I was able to answer it, Jessie.
Yes po, no?
Okay.
Before I move on to the next question, baka Vincent, you would like to say something?
Yung naisip ko lang dyan, no, especially with the elections, I think one important thing to look at, like especially diba sa platforms, siguro how a post-election Philippines will continue to address tuberculosis and family planning is hinged on whether or not we will elect a candidate that is always giving out motherhood statements. So alam na natin yan kung sino yung nagsasabi yan, di ba? Yung naisip ko dyan kasi with regard to, I guess, what would happen, no? I think it's also important to remember na syempre, I guess the pandemic is, there's no end in sight to this. I think it's also important that yung pipili dating leader, no, is someone that can balance, I guess, yung healthcare tsaka yung economic planning. And it's also, I think, important to note na, I guess, if we do elect someone, God forbid, no, na pala motherhood, yung naiisip ko dyan is I guess the response will be more or less the same as what we're currently having. We do see a problem, diba? We have a lot of, you could say, I won't mention names though, but I note that there's someone, diba, in the DOH, the technical working groups, diba, and the IATFs that are publishing misleading information, diba, on how to like address yung COVID. I think it's important na maybe after the elections, that can also be addressed. And I think that can be helped if we do elect someone who follows the science, who is very who really favors like yung data tsaka evidence in order to solve this crisis and adopts a whole of nation approach in tackling like this multifaceted issue. I hope that answers the question.
Yes, yes. Thank you, Vincent and Doc Pilar. No, naalala ko pag nagle-lecture si Doc Pilar ng policy, like how to make a policy recommendation or a policy report. Para lagi niya sinasabi na dapat evidence-based, ganyan. So parang syempre dapat sa plataforma din ang kandidata natin. Yes, Doc Pilar, you were raising hand po.
Oo, if I may add lang, Jessie, and thank you very much for that, Vincent. Kasi baka mamaya wala nang tanong sa amin, hindi ko na masasabi to. So, Jessie, no, yung dalawa, may binanggit si Vincent sa part niya ng presentation kanina, the newer laws, much more comprehensive laws, both on TB and family planning. For TB, yung Comprehensive Tuberculosis Elimination Plan Act, RA 10767. And for family planning, yung Responsible Parenthood and Reproductive Health Act of 2012 or RA 354. These two comprehensive and newer laws on tuberculosis and family planning are heavily dependent on partnership between the national government and the local government, and are also kind of dependent on good funding. So, ganun ka-importante ang magiging role ng kung sino man ang uupo na bagong government officials natin, how well these officials can foster good relationship between the national government and the local government, so much so that they kind of capacitate each other, but more so the local government units, no, in providing healthcare provisions related to tuberculosis and family planning. And of course, sa lahat ng yan, nothing will happen kapag walang pondo. So, siguro, just to kind of capture what Vince and I are trying to say, and correct me, Vince, if I'm wrong, no? Very important, kasi sabi mo nga election, very important yung kandidato, or at least sino man yung maboboto, na mayroong handle or kahit papano ay mayroong strong belief on the science behind combating health issues such as tuberculosis and family planning. At mayroong believe, no? Mayroong confidence in the kind of output that can be generated if there's good relationship between the national and local government. So I hope that kind of captures what Vince and I were trying to say. Thank you, Jessie, for the time.
Yes. Yes, Vince.
Pang dagdag na lang po, naisip ko lang no, when Doc, you mentioned about yung national local partnerships. I think it's also important na when we do decide to elect our leaders na, syempre diba, it is expected na mag-establish naman talaga siya ng good relationships with LGUs. But sana naman we'll be electing someone who does not deal with them in a transactional manner. I think diba, yung personality tsaka patronage politics is like so, I don't know, 19th or 20th century. So sana naman diba, since syempre our health programs diba, are, I guess, hinged on national and local cooperation. Sana naman yung pag-reach out mismo ng national to the local and vice versa is something that is genuine and I guess something sincere, not just for political and personal gain. So, yun lang.
Ay, ganda. Okay. Sige po, no? Ganda nung ating discussion. Pero we have a last question siguro po because we are a little over time, ano? And maybe Doc Dennis can address this one. Ano naman daw po, so from government and the LGU support and policies, ano naman daw po ang role ng private sector in the innovation and implementation of adaptive strategies po during the pandemic?
Thank you, Jason, and thank you for the one who sent that question. Actually, sa design ng ating health system local and national, it's always public and private sector partnership, no? Ang ano ngayon, ang shift actually with the universal healthcare is that these innovations or this partnership should now be done within the context of local health systems, no, yung province-wide and city-wide health system. So nagkaroon ng reframing of the partnership context when before you could actually just do a partnership arrangement, for example, at the national level and introduce it at the local level, basta tinanggap ka. Ngayon, hindi. No? Ngayon, kailangan tanggap ka, no, sa local level, no, because the authority has been given to the local government units. The other is that yung further local autonomy, no, through a series of executive and legislative initiatives, no, we have the Universal Healthcare Law na nagbigay ng further local autonomy. You have Executive Order 138, no, under for further devolution of services. You have the Mandanas Garcia ruling, which gives them across the board around 27 to 30% additional resources across their programs. So they have more authority and they have more resources, no, at the LGU side. So magkakaroon ng ano talaga after the elections, medyo magkakaroon ng reframing and reconfiguration, no, at the, and we're seeing that already at the moment. A lot of the private sector stakeholders have actually started doing that. They already entered into partnerships or with the local government, province and municipal level or city level, so that by the time, no, that the universal healthcare implementation is actually more established, that they already have a place, no, in the respective implementation processes of the of course malaki isang part lang yun. The other part na we still have the big pharma, multinational companies, no, on the commodities and technologies, which actually to a certain extent, no, may input sila at malaki yung kanilang say, no, in terms of the availability of these commodities and technologies in the and of course there are these network hospitals, no, and these network hospitals or network facilities are actually expanding over time. So you hear now of network hospitals across the country with this number of beds, thousands of beds already under their control, and the referral mechanisms already being coming from provinces going to the tertiary hospitals in Manila or the big cities. So may reconfiguration. I think after the elections and as UHC is being implemented, there will be reconfiguration of this because na-reframe yung health system context natin. There is a reframing process ongoing and it will happen in the coming years. Siguro last point na lang on the coming elections kasi mainit ang election eh. In a few weeks time we will be so I agree, no, na it the parang one of the criteria is looking at the track record, no, of these candidates, no, dun sa conceptual level, dun sa programming phase, and even at the operational phase. Kasi hindi naman bago yung problem, no? Yung COVID is just one problem, yung TB is just one problem, yung FP isa lang problem. Marami na tayong naging health and other health-related problems in the past. So we more or less know how people or how certain candidates or officials would react or would do, and na-test talaga during the COVID pandemic. It was a test of management skills, test of their yung analysis nila of the situation. So siguro yung pag-discern nun is one challenge sa atin, but at the same time to also engage, no, the candidates in terms of what they plan to do, and ask them and hold them accountable for things that were done or were not done, no, kasi it's the only way, no, na parang mag-respond yung ating system to what the people need, no, what the people think, what the people actually kailangan establish yung mechanism na yon, and the election in May is actually one way na ma-trigger yon or masimulan, no, for those areas na wala pang ganong mekanismo. Sige, maraming salamat and back to you, Jessie.
Yeah. Sige po, no? So thank you, Doc Dennis. Naku, marami pa ata tayong dapat pag-usapan. Ano po, medyo naging, ang tawag dito, dynamic ang ating conversation, no? Pero at this point, dahil po kailangan na po nating mag-move on sa ating next panel, no? Let me just present our certificate of participation to our paper presenters. So let me just read po, no? The School of Social Sciences of the Ateneo de Manila University awards this certificate of participation to our paper presenters, Sir Joey Sescon, Doc Leslie Lopez, Doc Dennis Batangan, Doc Pilar Berse, and Mr. Vincent Legara, for their invaluable contribution during the 4th School of Social Sciences Research Conference with the theme Transitions, Transformations, and Transdisciplinarity, Doing Social Sciences in the Time of Disruptions and Accelerating Planetary Changes, held on April 18 to 20, 2022 via Zoom. This certificate is given on the 18th day of April 2022 in Quezon City, Philippines. So the certificate is signed by Dr. Alfred Pavlik and Dean Sarina Saloma Akpedunu. So we will be sending these to you via email po. So maraming salamat po sa ating panelists and congratulations as well. So to our participants, balik naman po tayo sa ating mga participants. Meron po ulit tayong evaluation form. So hopefully you can see it on your screens right now. So you can scan the QR code on your screens, or you can type sa URL po ng inyong browser, bit.ly/y4SOSSCONF S2. No? So please answer our short evaluation form for this panel session, as this will be the basis for tracking your participation in the conference. So only participants who are able to attend at least 3 sessions will be entitled to a certificate of participation. So we will flash that a few seconds longer para makuha natin yung link at QR, and our technical support team will also be putting the link on the chat box. So pakiabangan po ang ating evaluation form sa ating chat box. So yun, ayan, na-send na po ni Trixie. Alright. So at this point, this ends our panel 2. Supposedly we have a 15-minute break, but it's 3:15 na. So allow me to turn the virtual floor over to our next set of panel presentations. Let me call on Sir RM Zantua, the moderator for panel 3. Sir RM. Ayan. Go ahead po, Sir RM. You are nakamute po lang kayo.
Hello, everyone. Hi, I'm sorry for the technical difficulty. I would like to introduce ourselves. We are the panel on work during COVID-19. I am joined today by my colleagues from the Ateneo Department of Psychology and Ateneo Center for Organization, Research, and Development. I'll introduce them one by one. We are joined today by Dr. Menjola Tencalea. She's the Executive Director of Ateneo Cord. We are also joined by Dr. Errol J. Ilak, Dr. Tony Mactal, and Mikey Talamayan, all from the Center of Organization, Research, and Development, and Dr. Erwin De La Paz from the Department of Psychology. We will all be talking about the different papers that we've been doing on workers during COVID-19. Without further ado, I would like to call on Sir Errol Ilak, and he will be talking to us about his paper on job demand resources during COVID-19. Sir Errol?
Thank you, RM. Magandang hapon. Good afternoon, everyone. I hope you could hear me. Allow me to share my screen. Okay. Yeah. RM, see? Can you see it? Yeah. All right. Thank you. All right. Good afternoon again, everyone. I hope you're still A-okay at 3:18 in the afternoon on a very steamy Monday, Easter Monday. But allow me to share to you our paper on the worker experience a year into COVID, job demands and resources in the Philippines. So obviously, no, when you talk about COVID-19, it has dramatically changed, altered substantially the way that we do work, no? The way that we do our dealings in organizations. No? And because of COVID-19, there has been new demands that has come into play already. No? Um, Obviously, we have implemented new technology. Diba? We are so used already with Zoom functions or Google Meets. No? We have shifted from face-to-face to remote or hybrid work even. We have done also, our line of work right now has happened to be more reliant on virtual teams since everybody is now doing things on an online platform. But because of that, one demand that has come into fore is also that parang ang bigat na ng trabaho, di ba? Ang dami nang overloaded na tayo sa mga ginagawa. And majority of the reason that this has happened is because nagkakaroon na ng sapawan between our domestic life and our professional life. No? There are now domestic challenges that are happening. At the same time, there's now your work-family conflict. No? While you're thinking of Zoom now, you're also thinking what will be for dinner later tonight. You know, those kind of things. At the same time, you know, as we go on doing work online, we have that feeling of insecurity in terms of our work. Meron pa bang trabaho akong madadatnan bukas? Can the company, can my organization survive this pandemic? At the same time, in addition to all of that, you're also concerned about your health, your well-being. No? So you have to adhere to strict protocols in terms of the requirements of government. Together with those demands, there are also resources that come into play. Since we are all working at home, no, to a certain extent, we have a sense of autonomy. No? The boss is not around technically, so we could actually do whatever we want to do within the time that we have. No? All of the activities that we used to do face-to-face in terms of employee activities have now been shifted virtually. And there are now training opportunities. Maybe you've done this before, no? That there are already training opportunities or you underwent online classes nung start ng pandemic. At the same time, communication is way faster because everything is happening now online. There are flexible work arrangements. So the work from home system is both also a pro and a con because you could also see now, okay, if I don't need to do it at the office, I could do it within the sanctity of my house. Mental health and well-being programs are also initiated, something that may not have been put in the spotlight before the pandemic. And particularly, you also have physical health and safety measures in place for all of us who are slowly going back to our offices. Nasanay tayo sa ayuda. So there are financial supports that actually as part of your resources during the COVID-19 pandemic. And there were material resources made available. If you cannot do your work at home because you don't have your laptop, go get it from the office and bring it to your house. Diba? Something to that effect. At the same time, there is the communication of short and long-term plans. What will happen within the next 2 weeks, within the next month, within the next 6 months. These are all part of the big planning stages. And these are resources of information for all of us. So this research contributes to the literature by exploring job demands and resources of Filipino workers a year into the COVID-19 pandemic. Majority of the research has been focused more on the early phase of the pandemic. And we know that it is not linear. No? There are waves, there are cycles in terms of the pandemic. This study is anchored on the job demands resources theory, which provides a useful framework in understanding employee challenges and means by which they address these during the stages of crisis. So there is a dearth of research on what has happened during, at the start of the period, at the aftermath stage of the pandemic. So itong new normal, things that are needed as we go along. So given this research that we did is very much exploratory in nature. So what we did at Ateneo Cord was to talk to 122 Filipino employee respondents, roughly around 39 years of age and about 7.5 years of tenure in their own organizations. So we did an online survey questionnaire, and it was disseminated through convenience sampling through the different social media platforms of Ateneo Cord. And critically, the time that we did this was a year into the COVID-19 pandemic, from March to May of 2021. So we asked for their informed consent, and the data that we were able to generate was analyzed thematically. So what did we find out? Obviously, one thing that is needed pa rin is still your technological limitations. There is still that issue of internet connectivity. There is that issue of digitalization within organizations, within offices. Work requirements as a workload, as in terms of your extended work hours, is still one of the main demands found by our respondents. May iba nasasabi, we have to do field work. We have to get out of our homes, from the safety of our homes, and actually go to work and then go back. So there is that health and safety issue. Nabibit-bit ko ba si COVID pagbalik ko sa bahay? That fear is still there. Even the sense of anxiety, depression, the mental health issues still abound. This is still one of those main demands during this time. Aside from the fact that I am locked at my house because I cannot go out during the quarantine, there is, of course, the lack of social interaction. We are so used to having lunch out with our friends, with our colleagues, face-to-face. Ngayon, kakain ka mag-isa, diba? Or with your family, diba? With them. But more often than not, you're losing communication with your colleagues. So interpersonal relationships also suffered as a result of the COVID-19 pandemic. Performance concerns was also an issue. Since boss is not around, how will the boss know if we are actually doing our tasks according to the requirement, according to the organizational standards? So there are issues in terms of monitoring performance. Maybe some people are subpar in their performance, or they can get to be demotivated already. This links actually to your salaries and compensations. And I think you know that during the COVID-19 pandemic, some people had to go underemployment contracts. Na parang dati, Monday to Friday ako, 8 to 5. Ngayon, MWF na lang. So what will happen to my salary? What will happen to the benefits that I used to have? How does this relate now to my security in my work? How does it relate now to my long-term plans? Nakakabit din dito, can the organization be financially sustainable enough to be capable to respond to the needs, to the adjustments required because of the COVID-19 pandemic? Are there new business processes that need to be played out? Or will there be new adaptations to changes that might be required from organizations as we move forward? One interesting thing that came out from all the respondents was that merong leadership issues na bit-bit coming from this. Minsan leaders can tend to be insensitive. They don't trust the employees that they are performing as much as they're supposed to be, performing or at par with the requirements or the standards, or that sometimes the leaders are being seen as incompetent because they don't know exactly how to go about and navigate through the different challenges of the pandemic. This is aside from the fact that kasabay nito, may complexity pa ng work from home setup. I don't have a table where I will work in my house. Do I sit on the dining table and then do my work there while the kids are all around me? So there is a creation of a workspace that matters and that blurring of domestic life. At the same time, when you talk about the different resources available, pasok pa rin sa kwento yung idea na merong learning sessions. Most of the respondents said, one thing that the organizations did was actually to provide learning sessions about COVID testing, vaccination. the compliance to health protocols, no, ideas about what happens now about our healthcare benefits, no, and will there be other supports in terms of our mental health? Another resource that has come into play and is acknowledged by our respondents was that, yes, the work from home setup was actually promoted. If you feel unsafe stepping out, then you could do your work within your own homes. No? Catch lang, sana may resources. So sana, one thing that they also said is that at least it's good, no? Some of our organizations are providing the necessary resources for us. They provide the pocket Wi-Fi, no? The laptops that we might be needing because we know that internet infrastructure in the country is really, really bad. So at least paano may tulong in terms of the different resources that might be needed. They also highlighted that it is important for, as a resource, yung communication and sharing of information. Ano na yung next plan of the organization? Ano na yung next step in the process? What will be the next strategic direction of the organization as we move forward into this emerging normal? And then leaders are now tasked to adjust organization policies and systems. Gone are the days of face-to-face recruitment or performance monitoring na talagang tututukan mo. So you now have to find new innovative ways of delivering all of the requirements of the organization, albeit in new ways, in a new paradigm. So one thing that the respondents also highlighted is that one important resource that organizations must consider is that they have to keep the employees engaged. They have to know how they are feeling, how are they reacting towards everything that has happened so far. And one important resource that our respondents stated is that there should be consultations with them. May kapihan session, may kamustahan session to allow the employees to suggest, voice out their ideas, provide insights on, and probably recommendations on how to move forward with this new normal. So all of the findings that we found out of the 122 respondents actually put some check boxes in past research. You know, they were still talking about the use of technology, the hybrid setup, the work overload, the adaptation to changes that might happen within and outside the organization, and work-life balance issues. So their responses actually echo what past studies have actually stated. However, one thing that is striking is that they highlighted that leadership is both a demand and a resource, and that leaders in organizations must be competent enough in communicating sensitivity and trust, and that there is a need for them to be strategic thinkers, really thinking way ahead, figuring out what will be the next step in the process. They have to be also timely problem solvers and decision makers. We've seen already how COVID-19 changes dramatically. No? After a few months, may bago na namang mangyayaring form, variant ng virus. And organizations have to be agile. Leaders have to be agile to respond to all of these. One thing that is echoed by the respondents is that there is a need for leaders who should highlight the well-being needs of their workforce. It's not just all about the outcome to make sure that the organization remains financially afloat, but you have to also take care about the employees of the organization. Karingal Go et al. Actually emphasized this in an earlier study, which said that leaders' capacity to attend to the person is through showing compassion and care, and being proactive, decisive, and solutions-oriented. Another contribution that we found is that communication is essential. We should not rely on technology. The virtual platforms are there to help us out, but given the technological infrastructure of the Philippines, it might have more problems than provide solutions. So communication is actually vital. It's not enough to rely on the virtual forms of communication, given the different issues. It has acknowledged that excessive workload, the undigitized business processes, the lack of technological know-how, all of these add up to make work difficult. So what is critical, according to our respondents, is that there should be a review and modernization of business processes. Baka mamaya, nagbabago na yung business model. And this new business model should maximize technology, capacitate your employees, and have more mental health program initiatives. So what does this mean? How does this mean now for organizations, really? Organizations must review existing policies and processes. Is it still fitting given the new scenario, the new normal that is apparently on our feet right now? No? And leaders are in a better position to ensure that the resources are available to all the employees and that they could actually safeguard well-being and maintain and encourage productivity. So it's not just about getting the output, getting the outcomes, ensuring that the results are there, but also taking care of our organizational members. Now, it's a fact. Some of the demands may not be easily addressed. No? Kapag kailangan pa ng mas maraming budget, mas maraming oras, diba? Mas kailangan ng mas maraming tao to solve these issues. So how do we do that? We have to have our line managers and the supervisors, the ones closest to the employees, to produce need-based measures to ensure that all of the demands effects are mitigated while we are waiting for more formal policies, for more procedures and guidelines that are being conceptualized. So we have to empower the leaders closest to our employees, no? The line managers and the supervisors, to ensure that they are capable of creative ways of addressing the issues habang nag-iintay tayo ng top management movement. So these are some of the different implications that we found out when we looked at the different ways that there are now new job demands and resources a year into the COVID-19 pandemic. I'd like to thank you for your kind attention. RM, back to you.
Thank you, Sir Errol, for talking to us about job demand resources. Before I introduce our next speaker, I'd like to invite everyone, if you have any questions, please send me a private message, a direct message, or send this to our technical support. We'll answer all your questions at the end of everyone's presentations. Thank you. So our next presenter today is Sir Dr. Erwin De La Paz. He'll be talking to us about examining work-life balance of married and single employees during the COVID-19 crisis. Sir Wine?
Hello, happy Easter and good afternoon to everyone.
Happy Easter, sir.
I'd like to share my slide. RM, can you see my slide?
We can see the working slides, sir, not yet.
About that one.
Now, we're okay now, sir.
Okay,
Thank you.
all right. Okay, so thank you for having me here. I am Wine from the Psychology Department, and I would like to share our study entitled Examining the Work-Life Balance of Married and Single Employees During the COVID-19 Crisis. So to start, having a perception that our work and non-work activities are compatible and does not overlap is indeed essential in enhancing individual and organizational productivity. Existing scholarship reports that work-life balance enhances our job performance and likewise our organizational pride. Others also found that having work-life conflict can diminish our job satisfaction and even our health. So during the COVID-19 pandemic, studies found patterns of shifting work-life balance among employees. So there are reports suggesting that balancing work and life became more challenging. This is especially true among employees caring for children and their household. So kung meron tayong usually pag nasa bahay, meron tayong mga inaalagaan din, medyo mas challenging according sa existing literature. There are others that had better work-life balance because of greater flexibility and the removal of the need to commute. Iba naman, they think na mas naging maigi yung work-life balance dahil hindi na kailangan maipit sa traffic. Nasa bahay ka na, pwede ka nang mag-work. No? So merong iba-ibang way of seeing yung naging effect ng COVID-19 pandemic sa ating work life, no? So while these studies focus on how work-life balance shifts, there are lesser studies that look at varying contextual factors. And one of it would be the marital status. So past studies about marital status and work-life balance identified non-work domains that should be balanced together with work. So we have non-work domains like family, personal care, and others. Notice that the order of priority is different between married and single employees. So personal care comes in second for married employees, while hobbies for single employees. And with the restrictions during the pandemic, we can expect that some of these domains could potentially either be enhanced or suppressed, and in the process, alter our work-life balance. No? So given this, we asked the following questions. We wanted to know if there are changes in the employees' work-life balance 1 year into the COVID-19 pandemic. And we also wanted to find out what contributes to the increase or decrease of work-life balance among single and married employees. So for our participants, we had a total of 127 employed individuals. Their age ranges from 20 to 68, and their average age is 38. So 45% are married, while 55% are single employees. So we carried our data collection through convenient sampling and an online survey. So we asked our participants to rate their work-life balance prior and during the pandemic and ask them to elaborate their answer. So for our data analysis, we employed a mixed methods approach. So our quantitative strategy accomplishes two tasks. First, through a paired t-test, we determine if there is a significant change in the work-life balance of employees during the pandemic. And then second, through topic modeling using latent inertia location. So we determine group of co-occurring words we call topics. So for example, one group of co-occurring words could be late, hours, and week. So using this group of co-occurring words, the computer algorithm then clusters all utterances that have similar words with that topic. So for instance, an utterance that says, I work late hours every week will be classified under the topic with similar co-occurring words that include late, hours, and week also. Then, for our qualitative approach, we develop themes that encapsulate these computationally derived topics and examine the clustered utterances that were clustered under each topic. So for our findings, so indeed, there is a significant change in the employees' work-life balance 1 year into the COVID-19 pandemic. Many participants reported a decrease in work-life balance. And looking at those who decreased their work-life balance, there are more single employees, no? So about 46.74%. While as for those who increased their work-life balance, there were more married employees, no? So it's about 13.04%, no, for the ones who increased their work-life balance during the pandemic. So now for our second question, what contributes to the decrease of work-life balance among single employees? So first, we found out that it's the overlapping work and personal spaces. So notice the words written in bold letters. These are the co-occurring words in the utterances. So employees leave their stress at their workplace, but having the same space for work and rest meant that they may experience stress even at home. Yung iba kasi siyempre pag uwi ka na, yung mga kailangan mong gawin, iniwan mo na din dun sa office. Pero ngayon dahil gagawin mo lahat sa bahay, minsan naisip mo lahat yung stress, no? Kahit nandun ka na sa bahay, no? So hindi mo parang naiiwan. So yung space has something to do with changing our mindset, no? Sa ating balance. Then second would be dwindling time for social life. So single participants find that physical interaction is important. Having physical presence during interactions allow participants to experience conversations with non-verbal exchanges. So this one plays a role, no, in expressing intimacy, feelings of closeness, and interconnectedness. So iba pa din according sa participants yung pagka face to face nandun yung ating mga kaibigan at mga kamag-anak. So there's this certain intimacy and interconnectedness na hindi natin nakikita sa virtual. Diba? So pagka face to face, pwede tayong makipag-high five, di ba, sa mga kaibigan natin, no? Sa mga kabarkada. Siguro along that line. So third, there is converging working hours and personal time. No? So single employees express that organization heads do not follow working hours. So they feel that they are always on call 24/7 and even on weekends. Dahil nga online. And they also felt that they need to respond to messages urgently as they are not sure when the person will be online again, and because they think that the person expects them to respond immediately. No? So meron ganong thinking, no? That dahil online, parang kailangan mo sumagot kagad, no? And then yung nga, easily reach ka rin, no? Kasi nga online, no? Makikita ka dun sa, halimbawa, sa phone na online ka. So, yeah. So these are the three factors or aspects that we found, that the single employees found that contributes to their decrease in work-life balance. So now, how about dun sa mga married employees, no? So kagaya natin sa mga married, no? So ano ba yung nagko-contribute sa decrease ng work-life balance? Okay, so first, okay, so one is blurring boundaries between work and family time. So this happens because married employees experience difficulty detaching from work. They express that they are easily reached through technology and they feel connected again, no, 24/7, just like the single employees, and that they have both personal and work communications merge. So kumbaga, dahil magkasama doon sa sa platform yung ating work at saka personal life, parang feeling ng mga married couples, no, na ang hirap i-separate, no? Parang gano'n, ang hirap i-separate. So they also this also happens, no, because there is merging family and work activities. So married employees feel that to achieve work-life balance, no, sabi nila, there is a need to do work outside from home, no? So according to them, blurring of work and personal life happens because of staying at home for a long time. So siguro maybe sa start, mayroong balance, but habang tumatagal, ang hirap na. So ayun, no? Pag tumatagal. Ayan. So now, what contributes to an increase of work-life balance among married employees? So this is what we found, no? So married employees express that spending more time, family time, okay, helps increase their work-life balance. So this is possible because there is a reduction of travel time, no? Dahil hindi na nga kailangan travel, no? So hence, because of that, they can spend more time, no, for productivity and being with their family. No? So mas madaming na-spend na maging productive. Maaga natatapos yung work, so mas maraming time with family. So another reason is that it's the presence of their family, presence of family. No? So being physically present with one's family is essential, no, enhancing work-life balance, because our families serve as source of psychological support, diba? And safety and security. So iba yung kasama natin yung sumusuport sa atin sa life natin, diba? So for the participants, ito yung isa sa mga experiences nila, no? So they're able to work because yun nga, kasama din yung family at yun, they get yun, ganung klase ng support from the family. So what are the implications of the study? No? So first, to help employees balance work and personal life as we head towards the next possible, where there are various working setups still. Merong hybrid, merong iba-iba pa din, no? It will really be helpful to look at marital status, no, when conceptualizing and implementing guidelines and policies. No? And then second, findings of our research can also be helpful when formulating support systems in the form of work-life balance and work-from-home programs and trainings. And this can likewise involve family members so that we enhance our ability to balance, no, both work and personal activities. And in the end, of course, that benefits us also, no, because we will not be that stressed and we'll be able to work productively, no? Mas productive tayo sa ating work. So that's it, no? So thank you very much, and in behalf of our research team, Tony, Felice, Ma'am Joy, and RM, thank you for listening. Good afternoon.
Thank you, Sir Wine. Thank you, everyone, for taking the time to listen to our presentation. I'd now like to introduce you to Dr. Tony Mactal, and she'll be presenting to us her paper on job loss during COVID-19, a phenomenological study on the experiences of Filipino migrant workers. Ma'am Tony?
Yes, good afternoon, everyone. So let me attempt to share my slide, if I can.
Okay.
It's not sharing properly, RM.
Sige, ma'am, I'll do it for you.
So you do it. Okay. Sige. So as mentioned by RM, I am here to talk about another paper that we were able to complete, no, entitled Job Loss During the COVID-19 Crisis. So this time around, I will be talking about OFWs. Okay. Sige. So essentially, no, what happened during the pandemic? Massive involuntary job loss occurred, and it is one of the most damaging, no, consequences of the pandemic. Okay, so what we essentially wanted to find out, no, was to really, or what we wanted to achieve was to provide an understanding of the experience of sudden job loss among Filipino migrant workers. No? In particular, we wanted to look into their difficulties, the coping mechanisms that they utilized, and the critical resources that they relied on. No? And ito sana yung nag-enable sa kanila to overcome or to, at the very least, no, manage the challenges that they experienced. Okay? So what were the research questions that we wanted to answer? First, what are the experiences of OFWs who have lost their jobs during the COVID-19 pandemic? Second, okay, what challenges do they face? Okay? Third, what coping strategies do they practice? And fourth, what resources do they rely on? Okay? So before I present to you our findings, no, let me just talk about some very important concepts related to job loss. Okay? So as we may have read about, no, or what probably meron tayong na experience personally at some point in our lives, nawalan tayo ng trabaho, or we have close friends or family members who experience the same. No? Ano ba ito? No? Ano ba tong job loss na ito? It is bad enough. No? It is disturbing enough to lose one's job at any given time, more so during the pandemic, when we are so insecure about our well-being, when we are so threatened by, you know, health risks, diba? Alam natin how costly it is to get sick, lalo na yung COVID-19 na virus. And for you to not have any resources to deal with that makes it all the more challenging. Okay, so what does the literature tell us? No? The negative impact of job loss in terms of job loss is robust. Okay? For instance, Bluestein and colleagues noted that unemployment has devastating effects on the psychological, economic, and social well-being of individuals and communities. So of course, the very obvious one is at the economic level. But as we know, no, lalo na pag tumatagal ito, the longer we are unable to find a new source of income, no, naturally, the effects will permeate, no, through other areas of our lives. So in this case, no, talagang tatamaan yung kanilang psychological and social wellness. Okay, so people who lost their jobs during the COVID-19 pandemic had higher levels of depressive symptoms and were more likely to report psychological distress and poorer health. No, you can imagine how many of us, kahit tayo na employed, di ba? Many of us experienced disruptions or challenges sa ating mental health. All the more for those who had this particular challenge to deal with. Okay? So when we talk about Filipino migrant workers, ano bang nangyari sa kanila nung panahon ng pandemya? So as of October 2020, 1.6 million of them were displaced, okay, and 500,000 lost their jobs. Okay? And then 400,000 were repatriated as of January 2021. Okay? Pero despite the big numbers, apparently there is a dearth in terms of, yung findings. Ano ba talaga yung pinagdaanan nila? What were their challenges? And what were the relevant resources that they relied on? No? Ito yung mas importante nating malaman. Okay? So when you talk about the research setting, this study was conducted in the Philippines, of course, during the pandemic. We were able to talk to 12 OFWs. They were chosen via purposive sampling. Okay? And of course, meron tayong inclusion criteria. So they must have or they should have experienced job loss around 3 months, no? Nung in-interview sila. Please take note that when we interviewed the respondents ng aming study, this was medyo malapit ito nung nag-declare ng lockdown. So around April, May, June, mga ganong panahon, no? And they should be a significant contributor to their families' finances, no? For many of them, they are the sole income earner. Or kung meron man yung mga asawa nila, still, mas malaki yung kanilang tinatira. Okay? And we also administered a screening pool because we wanted to make sure that when we interviewed the OFWs, we will not be also causing more pain, no? Or more disruption sa kanilang naging experience. We did not want to also interview those who may already be experiencing pronounced, levels of distress. So we use the prolonged grief 13 scale. So for those who were able to meet the cutoff score, we referred them to a center. So there were around 4 of them. So yun po, no, we had a mechanism for referral para naman po meron silang makausap at merong makatulong sa kanila. Okay. So in terms of data collection and analysis, so we went through the process of obtaining clearance from UREO, okay, and then as mentioned, they were interviewed using the semi-structured type of interview. The data was analyzed using Willig's phenomenological approach, and validity was ensured through several rounds of intercoding, with different members of the research team. So now let's talk about the results. Okay? So there was a common sentiment among several participants that their employers were unable to handle the process in a systematic and just manner. Okay? This was something they experienced prior and following their job loss. No? So hindi naman po lahat, no? But some, no? Some of them really had a hard time because, no, as many of us may already know, the pandemic came in a very sudden, suddenly, no? Wala namang prepared nung nangyari ito, no? And there was no blueprint for anyone to follow, kaya talagang medyo nagkagulo. Okay? So there were also conflicting messages, no, coming from employers. Some OFWs believed that they only had to wait things out, no? Parang sige, hintay lang tayo, no? And when things get better, when things settle down, we will be able to resume, no? And we will go on as usual. No? So some of them were willing to work without pay. No? Kasi akala nila it will be for a very short while. Okay? Some of them took a pay cut. Okay? Some of them were not able to receive their bonuses, or yung iba nga, until later on, they were not able to receive their back wages. Okay? So that was quite difficult, no, to understand. Parang it was due them, but it was not available anymore. Okay? Also, there were many challenges encountered during the repatriation process. Again, the suddenness of the pandemic, and most everyone was caught unaware. So wala tayo talaga naging proseso. Kasama na dyan ang Pilipinas, no? So as mentioned, some had very little money, no, to purchase their tickets, no? So yung ibang employers sinabi, oh, you have to go back, no? Parang wala nang work. Okay, after waiting it out, so what happened was they had very little money left, but they had to fend for themselves, look for accommodations, and then because of the restrictions due to travel bans, no, so yung iba na delay. Some were like held up in their hotel rooms or wherever they were, no, they ended up staying. So ganun din, no, they were incurring expenses. So talagang lalong nauubos yung kanilang resources. Okay? And then, you know, part of the challenges that they also had to contend with was the disorganized government response. No? Sadly, many of them reported that upon reaching, no, the Philippines, meron silang naririnig like, you know, hindi priority ang OFWs, no? There was no organized way of extending assistance to them. Some of them had to go to different agencies, had to approach different LGUs just so they could access help, no? Yung iba nung ni-report nila, no, in their narratives, parang oh, may pera naman yan, OFW yan, no? So their income, that dollar earners. So hindi naman yan talaga kailangan ng ayuda. No? And that was a very painful thing for them to hear. No? Kasi, ang sabi nga nila, like everyone else, we experience job loss and we also need help. Okay? So what were the challenges that they faced? So additional challenges. Yeah, mental and emotional health issues. As mentioned, diba, it may start off economic in nature, but it permeated other areas of their well-being. So, ano yung sinasabi nila dito na what will happen to my children, what will happen to my family because I'm no longer earning. Okay? How will we manage our daily needs? Okay? Financial, of course, I will not belabor the point. Some of them were in debt. Okay? I mean, perhaps others would think, yeah, dollar earner yan. So they must have a lot of money. They must have savings. But apparently for some of them, wala. No? They didn't even have like a buffer of sorts. Okay? Job seeking was a challenge. As much as they wanted to find a new job, it was not readily available. And I think that was what most everyone experienced during the pandemic. Mahirap talagang maghanap ng trabaho regardless of your previous employment experience. Okay? Another challenge was adjusting to change. Yun nga, no? Some of them were what? Seafarers, flight attendants, no? And not everyone naman could readily, no, change the nature of their jobs or the skill sets required. No? Yung iba for many, many years have been doing essentially the same job. Because all of a sudden, you need to learn things in an online way. No? Magtatrabaho ka, you have to learn systems, you have to learn programs na hindi mo naman ginagawa in your previous job. So how do you now learn quickly, no, and well enough to do or to perform well in your new job? Okay? So kailangan pa nilang mag-aral very fast. Okay? So what did they do, no, to cope with these challenges? Okay? Number one, no, many of them cited how they chose to count their blessings. No? They were in a desperate situation, but they reframed that, no, by focusing on ano nga bang meron ako. Diba? So there's no need for me to be extravagant and I don't need expensive things. No? One of the realizations that they had during the pandemic. Kung ano yung basic. And again, I think many of us also realized this. No? Parang simple lang naman ang buhay na kailangan natin. So, I'm going to count what the blessings that I have. Okay? Turning to religion and spirituality. So I guess culturally also, no, Filipinos talaga namang this is something that we rely on, no? Through thick and thin, no? Talagang lumalakas ang ating kapit sa Diyos, no? So many of them read the Bible, they attended online mass, they prayed, okay? And they also practiced self-help skills, no? So what other OFWs did was to re-establish connections, no, with other colleagues, other friends. Okay, nag-social media sila, nag-internet, no? Some participated in meetings and webinars, no? So aside from reconnecting with people, they also found ways to upskill, no? Para naman yun nga, no, kung baka kailanganin in the new job. So might as well make the most out of the online setting. Okay? And of course, no, they didn't stop naman looking for a new job. So importante naman talaga yan. Continuous effort to seek re-employment. Okay? And for some, no, who could not land a job in an organization, they opted to put up a small online business or a side job. Okay? Others, yun nga, no, learned a new skill. So may nag-aral ng project management, some studied website design or computer applications. No? Take note that many of these, no, were alien to them, were foreign to them, but they really found ways to equip themselves. Okay? Others, no, gave back to their community, which is such a powerful thing to do. No? Considering nga they were in a desperate situation, yung iba ang galing ng ginawa nila, no? They found it in themselves to conduct outreach programs, no? Merong nag-feeding program, so it's their way of giving back to their community. Okay, some, no, or there was one rather who opted to help fellow OFWs kasi alam niya this participant knew about this how desperate their situation was during that time, no? So ang ginawa niya, yun din yung tinutulungan niya. Okay, and then also a small percentage engaged in maladaptive practices. Although hindi naman ito nag-persist. Okay? For a certain period of time, they were snacking on unhealthy food, no? They remained inactive, or they isolated themselves. So, fortunately, later on, medyo nakapag-recover naman sila yan. But for a time, no, meron ding who experienced this particular type of coping, no? Medyo pababa ng kanila. Okay? So what were the helpful resources for them? Let's start with what came from within, no, the internal resources. Okay? Yun, no? Having a positive and hopeful outlook. Okay? Being grateful, looking at the bigger picture, okay? Remaining strong, rising to the occasion. Okay? I may cry at night, yan, but when I wake up, it's a new day. No? So that was really like a battle of sorts. No? Na parang, yeah, I have this challenge to deal with, but I am going to counter that, no, with positivity and hopefulness. Okay, and tied to that will be adopting a can-do mindset. Okay, yan. So by hook or by crook, I will do everything I can to achieve my goals for my family. Remember, no, we're talking about Filipino workers, and for many OFWs, no, the reason why they leave the country is to find a good job, no, na nakikita sila ng malaki para sa pamilya. No? Kaya it's such a big problem for them to come home and to no longer be able to provide for their families in the same way they were able to do, no, prior to the pandemic. No? Parang biglang nag-crash yung kanilang economic status. Okay? Faith in God, no? Again, another internal resource. God has given me reasons to live every day. My faith will never be shaken, no? So again, that strong faith in God really helped them navigate the everyday challenges. Yeah, the belief that God will provide. Okay. What other resources? No, externally, no, they relied on family support. Okay, talagang napaka-importante ito para sa kanila. No, I guess especially, no, sabi nga natin, you earn for the family. You support your family. Minsan, it's not just your immediate family members, but an entire clan, perhaps, no? So for them to be able to rely on family support is a very critical thing. So I'm blessed with a very supportive and prayerful family. Okay, I have a child who helps, no? Kasi some of them naman have income-earning children already, or they have siblings or in-laws who were, no, ready to kind of meet them salo. No? So sinasalo sila, or mga spouses nila who had jobs. No? They may not be earning as much, but still it was not like totally zero yung kanilang family income. Okay? Friends and colleagues. No? So some of them had really reliable or have really reliable colleagues. No? Sa mga trabaho nila, kahit na nawalan sila ng trabaho, they could still rely on some of their ex-colleagues. No? So patuloy pa rin yung iba tumutulong. And yung iba naman kasi, no, it was not totally like job loss na talagang wala na. Yun lang, no, medyo job loss kasi wala na silang certainty in terms of kailan ako magkakakontrata ulit. No? So yung iba medyo naka-on hold. No? Again, but with no assurance as to when they will be able to resume work. Okay? Other friends would, lend them money or help them apply. No? Tinuturuan sila what to do, would tell them, go to this site or learn this or whatever. no? This is how you create a resume. So it was really helpful for them to count on other people. Kasi nga, minsan, if left on their own, medyo di na nila magawa din minsan yung mga bagay-bagay nila. Okay? Company support, no? Fortunately, some employers did periodic checkups, no? So kinakamusta sila. Okay? Others, no, na nagkaroon ng issues with back wages were fortunate enough to receive, no, what was owed to them. No? So nakuha naman nila yan. Sabi nga nila, it may not have been the total amount that they were expecting, but at the very least, no, parang better than nothing. So mas masaya na sila doon. Okay? Government aid, no? Remember I mentioned how it was disorganized, no, in the beginning. It was not like miraculously parang umayos lahat and there was, abundant provision. Di naman, but also they were able to find help, no? There were certain agencies or LGUs that were able to provide help. No? So nakakuha naman sila some sort of monetary assistance, others in the form of relief goods, no? Or yun nga, yung minsan yung magpapa-quarantine, so instead of them having to shoulder the expenses, no, naging libre na ito. Okay? Other external resources, no, sabi nga natin kanina, ano ba yung ginawa nila? No? They found ways to earn again. So ayan, no, nag-put up sila ng kanilang online shopping and selling, no? Or they invested, no? I guess for those who still had money to spare, they were able to find ways to make their money grow. Okay? And of course, yun nga, no, many also did their best to land a job, no? And meron ng isang participant who also mentioned how she really did her best, no, to prove that she is an asset to the organization. Kasi nga, importante sa kanya to land a job, no? But then of course, there were others who mentioned na, the moment they knew, no? The moment they knew that we were, not OFWs, that we were seafarers, for instance, no? Ang sinasabi daw sa kanila, seafarer yan, aalis din yan, no? Parang, so, minsan that served as a block, no, for them to land a new job. That thinking na, they're not going to stay for long, so why invest in these people? Why hire them to begin with? No? So, kaya ang dami rin talagang difficulties for them. Okay? So, when we talk about what this study really highlighted, okay, the effects of unemployment on OFWs were exacerbated by what? Their contextual and cultural realities. And these realities really nuance, no, the experience of this particular group. Okay? So first, we have the magnitude of the crisis and the abruptness of change. Sabi nga natin, nobody knew what to do. We didn't have a prior experience. No, there was no template on how to go about doing things. So for many of us, no, even mga first world countries siguro, nangapa, no, ano nga ba natin to i-manage? Okay? Pero yun na nga, no, they were away from their families, some with very little money to travel, no, to pay for their needs. So that made it all the more difficult for them. Okay? And then they had there was the repatriation process to contend with, okay, and that lingering what do you call it, heartache for them, no? The thought na, okay, I'm going home, I have very little money, what will happen to my family now? How will my children go to school? No? How will I pay for their needs? No? I used to be someone who could provide for everything. Tas ngayon biglang zero. Okay? So that was a common sentiment among the OFWs. No? And also, yun nga, yung sinabi natin na, bakit parang we are not a priority, no, of the government. No? So they could see how many other people were receiving their ayudas or their financial aid. Pero sila parang to be told that you are not a priority. Parang that was really something that they could not understand. Okay? So as I mentioned, it was doubly hard to find employment opportunities. Okay? So with no clear prospects as to what will happen in the future, okay, or whether they will be able to land a job in the Philippines or elsewhere, okay, not being able to provide for their families, really pushed their ability to cope with the situation and to remain resilient. Okay? So kaya importante talaga, no, na sana may resources ang ating mga OFW so that in situations such as this, no, they have something to draw from. Okay? So in terms of the practical implications, what this study highlighted is the need to have an organized system and policies that will guarantee the provision of support for OFWs, whether it is a crisis situation, an emergency, or any form of disruption. Although their contribution to the Philippine economy is often lauded, diba? We proclaim them as the bagong bayani, When you talk about the Philippine economy, try removing the revenues that we get from OFWs. I don't think, ito yung estado natin, baka mas grabe pa, So kaya nga parang bakit ganun? They are lauded as modern day heroes, pero pag sila na yung may kailangan, parang feeling nila tuloy, it's a kind of a one-way thing, right? It is also important that OFWs receive supplementary training programs wherein they can learn about helpful coping strategies and techniques. I know that my father used to be an OFW, so I know that during his time, ang ginagawa when you leave is that you are given an orientation, in terms of what to do, yung familiarity, yung mga laws and all of these things, So maybe there is a need to beef up the kind of trainings that they also receive, some sort of a resilience training, so that pagdating ng mga ganitong sitwasyon, it is not going to be a very reactive process, Instead, meron na silang skills to draw from, they will be able to at least, at the very least, manage, and hindi sila abot sa point that they will suffer from mental health issues, or they will come home and then the entire family system will also be problematic. Okay? So also, ang isa pang maganda siguro din dyan ay the family members. Katulad ng sinabi ni Wine a while ago, he talked about well-being, nakasama ang family members. Dito rin, it will be very good for family members to be part of training programs, For instance, financial planning, Some manning agencies, for instance, when you talk about seafarers, they have that, They teach family members, they teach wives or whoever is, getting hold of the money to really plan, to budget and to use it wisely. Kasi nga it is not unusual for OFWs to find themselves moneyless or in debt or with very little money the moment they return to their homeland. Kasi hindi maganda yung pagkagamit ng pamilya. So if family members are also taught this, along with other, kung sila din if they can learn about, what mental health is all about, how to support their OFW family members when they are brought home for whatever reason, para matulungan. Because as we know, if external help is difficult to come by, then at the very least, the family members are already equipped. They have a way to somehow manage that. And pagka oras na when medyo malala na and there will be a need to refer the OFWs to the mental health professionals, at least hindi umabot dun sa parang lumala lang. And the OFWs are trying to manage it on their own with their family members, clueless as to how to help their loved one. So we are hoping that through this study, this is something that we can communicate also to the people, the LGUs, or even the government. Parang ito ang kailangan. It is high time that we do something for our OFWs, given how challenging their experience was, and how how salient the lack of support really was for them. Talagang parang wala, halos wala, very minimal. And if we are to really support them, we want our programs to be in place, to be organized, and not something that we will just draw from wherever randomly or come up in a very reactive way kasi nga hindi naman tayo prepared. So mahirap din yung ganon. We may be leaving so many things to chance, and when we do that, so many other things may be left unattended. So marami pong salamat, and we hope that we were able to contribute to what is already present in the literature when you talk about OFWs, their experiences, their challenges, and their resources. Salamat. So on behalf of my co-authors, We have Joy Calleja, Feliz Caringal, and RM Zantua. Marami pong salamat.
Thank you, Ma'am Tony. I'd now like to introduce our next speaker, Ms. Mikey Talamayan of Ateneo Cord. She'll be talking to us about effective leadership in organizations in the Philippines 1 year into the COVID-19 crisis, an example from the Philippines. Mikey?
Thanks, RM. Just want to check if you can see my screen.
Yep.
Okay, thank you. So, good afternoon, everyone. I'm here to present our study on effective leadership in organization, as mentioned by RM. This is an example from the Philippines. So, we have seen the importance of leadership roles in handling the crisis, specifically the pandemic, no? And undeniably, we can observe some qualities of leadership and behaviors that are helpful during the pandemic. So, the purpose of our study is to identify leadership behaviors that employees deem helpful for the organization and also for the workforce, approximately 1 year after the onset of the pandemic in the Philippines. So by doing that, we can provide a more current picture of effective crisis leadership in our local context. And to guide our study, we actually use the 3 meta-categories of leadership by Ekval and Arvonen and Yukel and colleagues. These are the task-oriented leadership, relationship-oriented leadership, and change-oriented leadership. So ano-ano ba yung mga behaviors na makikita natin per category? So first, the task-oriented leadership. So this involves behaviors such as short-term planning, clarifying responsibilities, setting performance and objectives, monitoring operations. And for the relationship-oriented leadership, this is demonstrated by providing support and recognition by consulting and communal leadership. Then for change-oriented, it is mainly more on creative attitude and visionary qualities. So the behaviors can be monitoring the external environment, proposing new strategies or vision, or innovation. So a wealth of studies actually have shown that these qualities are helpful when dealing the crisis. Actually, in a recent study by Caringalgo and colleagues, it is the compassion, care, and supportive behavior were found as the most effective qualities of crisis leaders. However, it is we should note that the data were collected during the early phase of crisis. So, ano ba yung relationship ng parang phases ng crisis in identifying leaders, no? Because we want to know if the effective leadership qualities from the perspective of employees change from the onset of pandemic. So understanding the crisis phases is important because it will be useful in viewing the crisis not as a single event, but as a sequence of sub-events that have potential to bring considerable damage, losses, and interruption to organizations. No? So our study is actually situated when we are in between the occurrence and aftermath phase. Given that the restriction have somewhat loosened and still merong mga restriction due to surges in local areas. And to provide more context, our current research was conducted in the Philippines approximately 1 year after the declaration of COVID-19 pandemic on March 2020. So this current study is part of a follow-up study by a university-based center for research and organization development on the impact of COVID-19 on organization and employees. So we employed snowball sampling through social media networks and emails. And to get the perspective of the employee, we gathered data from 128 Filipino employees. At least they are employed for 6 months, and their average age is 39 years old with an average tenure of 7 years. So for the data collection and analysis, so based from the responses of the 128 employees, We conducted the open-ended online survey with a question: what traits or behaviors do your leaders exhibit that are helpful to you and effective for the organization at this point of crisis? No, and their responses were analyzed through content analysis, which wherein the researcher derived the themes, including the traits and behavior na nakita dun sa themes, no, were grouped into the leadership meta categories that I mentioned earlier. We also count the frequency of their responses just to check kung ano yung most salient or not. Okay, so findings show that is still the relationship-oriented leadership is the most effective quality of a leader during the crisis. What's interesting is that there is a fourth meta-category that emerged from the data, which is the influence-oriented leadership. So later, I will be discussing this more in detail. But first, let's discuss yung result ng three meta-categories. The result actually pointed out to several behaviors under each of the meta categories. So first, for relationship-oriented leadership, as you can see on the data, um, it is still the emotional support yung most salient on their responses. Of course, in a crisis situation where feelings of anxiety and stress may be high, employer regarded their leaders' ability to provide emotional support as essential. And this is demonstrated by compassion, patience, and empathy. Their responses also include giving more leeway in terms of deadlines and expectations on productivity. And also, other themes that emerge for relationship-oriented leadership is the communicating that is more relation-focused. So, ano yung ibig sabihin doon? It is the ability of leaders actually to relate with them as individuals. So, that is by conducting one-on-one checkups, by regular Zoom meetings, just to check personally parang anong kailangan nila during the pandemic. And I think the others are more straightforward, like instrumental support. That means providing the needs of the employee. Some responded actually say that yung organization nila provided medical assistance or the ayuda, and also even yung mga mask and alcohol were provided. Okay. So for the task-oriented leadership naman, themes under this were communication, information focused, flexibility, decisiveness, managing and organizing, and monitoring operation and performance. So here, I would like to highlight yung communication information because it is the cited the most parang effective quality of a leader under the task-oriented leadership. So this means that employees find it helpful if their leaders remain in constant contact and share valuable information related to work. So as mentioned by our respondent, this is through regular updates, checking in, and clarifying expectation that is more work related. So kanina, dun sa relationship is more on checking with them personally, yung status nila as for example, yung personal life nila and how are they doing. And dito naman sa task oriented, this is more on communication about work and also clear direction and instruction moving forward, no. And again, others are straightforward. For example, the flexibility and responsiveness. So a sample quote on this is making do with whatever is available in terms of human and material resources. Other respondent also mentioned the leaders are understanding the situation and actually addressing it. No. For decisiveness naman, this is demonstrated by leaders daw by making quick but sound logical decisions, have a sense of urgency but remain supportive. So they decide carefully but act fast that end they find it very important. And another quality of a leader or behavior is the strong organizational skills and problem solving minds. And of course, since we are in pandemic, I think that is also factor na kailangan the leaders are very quick in their decision and problem in providing solution to their employees. So here, for the influence-oriented leadership, this is the fourth meta category. And the themes under this is positivity, role modeling, transparency, and adaptability. So in this meta category, employees felt a positive impact kapag yung leaders nila are transparent and also provide um, positive comments or positive um, messages and through that behavior, they were able to calm their employees since most of the employees are feeling anxious during the pandemic. So for example, in transparency, the respondent or the employees felt that their leaders are effective when they are honest. So that means kapag, for example, in the statement, as you can see in the screen, when something is not working, they say parang they provide the step that needs to be taken to improve. And if things are bad, they will know the reason why because the leaders are providing parang honest feedback and help them um, parang navigate in the pandemic. Also, for the positivity, this is displayed by leaders through optimism and motivational and energetic. And for role modeling, this is exhibited by leaders naman by leading by example, knowing that their supervisor or head office is doing extra work for them. Ayan. And lastly, for the change-oriented leadership, the adaptability. So for the employees, this is critical because given na yung pandemic and the nature of the changes in the pandemic, it's important for their leaders to study and prepare early so that um, parang nakikita ng employees na their leaders can adapt in the changes that's happening, especially yung mga protocols in the Philippines. Sometimes it changes from time to time, yung mga restriction. So the employees felt that it's important that their leaders can adapt as well. So to share the highlights of our findings, so the finding is actually consistent with the claims of the recently published studies on the importance of caring, empathic, compassionate, and people-oriented leadership. No? So basically the relationship-oriented leadership. So this is essential to providing, sorry. So for the employees, it's essential to provide emotional support during the pandemic and engage in relationship-focused communication. And the employees actually value this the information focused communication. So again, the highlight of importance of the people oriented leadership. So what's noteworthy is the emergence of the fourth meta category, which is the influence oriented leadership. And again, as I've mentioned, this is characterized by transparency, positivity, role modeling, and also adherence to pandemic-related protocols and going the extra mile for the organization whenever is necessary. So again, this highlights that establishing mutual trust through authenticity and transparency is highlighted and also is a part of best practices among leaders. No? So these influence-oriented behaviors give assurance to the employees that they have a trusted ally that they can rely on and gives them hope that the company can survive the challenges. Also, for this study, some research limitation and implication. So this study used an explanatory approach in identifying leader behavior during the pandemic and was conducted with a limited sample. So this was also conducted a year after the declaration of COVID-19 pandemic. So we suggest to have a wider population to properly verify the veracity of the data, and to also conduct a longitudinal research to accurately determine the variations in leadership behavior as the crisis continues. And to share the practical implication of this study, so as we can see, behaviors that are reflective of the leader's character and tendencies have emerged from the analysis. And there should be initiatives that deal with leadership assessment, gathering and giving feedback, and coaching may be helpful to increase their self-awareness and mastery. Ayan. And again, organization can leverage on leaders' influence and encourage demonstration of effective leadership through enable constant communication with the employees.
Right. Thank you, Mikey. Before we move on to our last paper, I'd like to encourage everyone to send us questions for our Q&A. For any paper presentation that has been finished today, please send us questions and we'll try our best to get to them and answer them later. All right, so for our last presentation in our panel, we are going to be listening to Dr. Joy Calleja. She'll be talking to us about examining experiences of human resource management practitioners during COVID-19, a phenomenological study. I'm Joy.
Thank you, RM. Good afternoon, everyone. Let me share my screen. Okay, I think I just have to. Can you see it now?
Yes, ma'am, we're all good.
Okay, thank you. So I'm here to present a study conducted with Dr. Feliz Caringalgo and Dr. Errol Ilak. One of them presented earlier. They're both co-directors at Ateneo Cord and co-faculty at the psychology department. This research used phenomenology as the theoretical lens in examining the experiences of HR practitioners, human resource management practitioners during COVID-19. So as we already know and have experienced, COVID-19 has impacted the workplace in unimaginable ways, requiring organizations and employees to implement operational changes concerning many aspects of work. These experiences highlighted the valuable contributions of HR or the HR function during periods of crisis. And this study shows, our particular study, shows how HR practitioners contributed to the sustainability of organizations and draws insights on how HR can put the needed focus on the human side of organizational crisis management efforts during a global health crisis. So just like the OFW study, we used phenomenology as a framework to examine the experiences of HR practitioners, particularly during the first 2 months of the pandemic. Phenomenology allows for the exploration and deeper understanding of how we live through and make sense of various situations that we encounter in our lives. So this specific mode of inquiry captures lived experiences from direct personal narratives, which are then integrated so that we can come up with a universal essence of a particular phenomenon. So in this study, this is reflected in the process of gathering actual accounts of individual HR practitioners during the COVID-19 crisis, and then examining the data to determine their shared experiences of the phenomenon. So using phenomenology, we sought answers and we asked these following questions that pertain to challenges experienced by orgs and employees, as mentioned during the first few months of the COVID-19 pandemic. So this is at the emergent phase. Also HR's contribution in org efforts to respond to the challenges that's experienced at this time of the crisis, as well as how HR managers made sense of these experiences. So we conducted online semi-structured interviews with 11 HR managers from April to May 2020. We asked these questions during the interviews and used Carlo Willig's three-step approach in conducting phenomenological analysis. First epoche that involves suspension of all our preconceived thoughts, and experiences as researchers to be able to look at the data as it was shared by the practitioners. Now, this is important for us, because as authors engage in HR consulting work. This was followed by phenomenological reduction, which captured what was experienced by the participants, and finally, imaginative variation, which entailed looking at the various factors and conditions that enable the experience. So the sharing of the managers primarily focused on the difficulties experienced by the respective organizations and employees at the onset of the COVID-19 crisis and how the HR unit responded to these challenges. As you can see in the figure, immediate and efficient HR actions were needed in particular HR functions. The experiences of the managers actually reflected HR's contribution in enabling first organizational agility, and second, ensuring responsiveness to the employees. So the challenges observed and experienced by HR practitioners were reflective of the novelty of the crisis and the understandable unfamiliarity with COVID-19 that made it harder for everyone actually to immediately respond to its impact. So the things that I'll share here, the needs and challenges, are also somewhat similar to what were presented by my colleagues earlier. So one participant, one HR manager actually expressed that the most challenging part is addressing employee concerns that you are not prepared for and have not yet encountered in the past. So all their organizations had to immediately transition to a work from home setup upon the imposition of the nationwide lockdown in March 2020. But there was also a lack of readiness for online work, which appeared to be the only way to continue operations due to quarantine restrictions. So another participant noted how his organization was pretty much traditional, especially in their finance and accounting. And I think we have a similar experience on this. They did not have a precedent for working from home, so everyone was really struggling. Budgets were very tight, not just because the business wasn't performing well, but because there are no people to process the budgets, because budgets are processed manually. So the efforts to enable the shifts in mindset and behaviors needed for remote work were challenged by the lack of familiarity with technological tools and the intermittent internet connectivity, which we all can relate to, with technical issues, delay and lag time in our internet connections, among others. The pandemic also differentiated roles, organizational roles that have to be done on site. Employees occupying these positions faced particular challenges. With the growing number of COVID-19 cases at that time, people were scared, and did not want to go to work. For employees who were willing to go to the office, travel restrictions served as a major roadblock. Yung isang participant said na public transport, and I know we also saw this and experienced this. Public transportation at the time was suspended, so workers had a hard time commuting. In their case, it took even 5 hours for their employees, some of their employees, to reach the workplace. So companies also felt the financial impact of the crisis. Just a few days into the community quarantine, there was also widespread fear of job loss if the ECQ will be extended, as seen in this narrative from one of the practitioners in the retail industry. So HR had to quickly adapt its functions and services to the emerging needs of the organization and its employees. So these changes were primarily was to ensure that there was sufficient manpower to continue operation. So after determining yung going to
Recording
the
in
supermarket,
progress.
what one of the participants did was to change their function from ambassadors to merchandisers. A lot of adjustments were done in benefits allocation and utilization that are within the function of HR. So employees were allowed to use their leave credits, vacation leave, sick leaves. They released bonuses to everyone. There were also new benefits provided to employees to encourage them to report to work. One practitioner shared that they had an incentive called frontliners allowance to and to enhance yung safety. Another organization subsidized employees' use of Grab cars to discourage them from using public transportation. Medical benefits to help address COVID were also provided. So aside from ensuring continuous salaries for everyone, HR also facilitated the provision of financial and material assistance to employees. So I hope you still remember our Blue Aid. So this is one example of that, what Ateneo gave us. So HR also assisted employees in availing COVID-related benefits from the government. They had to know the latest updates, not just on quarantine restrictions and number of COVID cases, but also on government support that can be availed of by employees. While HR practitioners wanted to be responsive to the needs of employees, they also had to make sure that they consider the current realities of the organization. One manager said that they're trying to juggle the capital released by the owner or the management and also the benefits that they can give to their employees. They do not want to immediately give all the assistance and then make a mistake in financial forecasting. They might be able to use up capital, and that can cause losses to their company. So for those who needed to be physically present in the workplace, support was given to ensure that they are able to safely come to work and remain productive. So aside from what were already mentioned, providing accommodation, shuttle service, transportation funds, HR also has to provide all the needed documentation to enable mobility, such as employment certificates. So remember, there were checkpoints. So one HR manager said she had to produce 1,000 certificates overnight so that their employees can come to the office. So employees were also provided tools and the technology to perform their work. One manager shared how they were repurposing jobs, and most of the interviewees mentioned how they helped enable the needed shift in mindset, especially of supervisors and leaders in terms of monitoring performance in remote work. So particularly on what is it that leaders had to monitor, how to set the weekly objectives also and priorities. So well-being was also enhanced by providing protective materials such as care packages, vitamin C, masks, hand sanitizers, soap, alcohol, and cleaning materials. So I remember two of my kids were already working, and their company sent them boxes that included all these vitamins, materials, protective materials, etc. HR also initiated rearrangement of the office setup and had implemented policies and guidelines to ensure safety. So this included putting a footpath, requiring people to have a change of clothes every day when they go to the office, measuring each room, in our case, each classroom and offices, to determine maximum capacity, setting up sanitation booths, and creating a site worker guide. One manager shared that they needed to schedule the lunch break and the break time to manage foot traffic in the cafeteria. They also constructed yung mga dividers, so it's like you're facing a wall when you are eating. So mental health support was also provided through various means. HR also helped ensure that employees and their families were provided with the needed medical support and other forms of assistance. They also provided or shared, actually proactively, shared health-related information such as ways to keep healthy, how to disinfect your groceries
Recording
after
stopped.
buying them, how do you keep your immune system
Recording
up.
in progress.
Okay, and self-care and how to cope with quarantine. So is that like a time's up thing or no, no? I think I still have a few minutes, no, just to
Go ahead
finish
na,
my
ma'am. Ay,
presentation.
napindang ko.
Okay, so one HR manager noted how it's important also more than ever to make sure that employees stay engaged, to make them feel that the company is there to care for them despite what's happening. So given this, no, yung mga engagement activities previously done in person were transitioned to virtual platforms. There were also mga new programs initiated during the quarantine. One manager talked about the executive vice president hosting a virtual party, the interns creating a fitness video that employees can follow while they are at home. So communication was also improved, no, enhanced through regular updates, newsletters, also messages from leaders. Although learning and development was not very much prioritized, no, HR thought about how can they help by offering coaching instead of formal training to their leaders and employees. So to ensure timely and appropriate response, HR had to be updated on the COVID-19 situation in the country and the government guidelines or announcements. No? So one practitioner, sabi nga, no, I had to consistently watch the news, which I wasn't doing before, no, so that he can check applicable policies, no, to their people. So this allowed HR to immediately shift strategies in the way it delivers its services and to actively help the organization in scenario building. So see that strategic role, no, of HR in what has happened. So as expressed by one of the managers, and you can see on the screen, no, creativity is needed so that they can think of what can be done for their people. So contributing to our efforts to address the immediate impact of the crisis entailed adopting new ways of efficiently communicating to various internal stakeholders, no, especially the employees. One manager noted how they realized that they became really resourceful, no, when it comes to communicating. Instead of just one email, ganun din naman tayo noon, they will now send it through group chats, the Viber groups, Messenger, no, different social media. They had to make adjustments in communication policies and practices to make sure, no, that HR was able to connect with employees. Okay? So as seen in how HR functions were delivered during the quarantine, enhancing efficiency also meant maximization of various online platforms and technologically enabled ways of doing work. Diba? Lahat tayo natuto ng Zoom, Google Hangout, Google Forms, Skype, Microsoft Teams, SharePoint, no, among others. No? And we use that in employee engagement, well-being programs, reaching out, no, to our colleagues, to employees, especially for HR, no, to ensure that the company has the needed warm bodies, no, to maintain operations, managing performance also, productivity, and delivering learning and development activities. So findings of our study actually highlighted the strategic role of HR in organizations, especially in periods of crisis. Effectively responding to these disruptions brought about by COVID required a heightened sensitivity to the needs of employees and the organization. And this was seen in how HR facilitated the provision of resources and work tools or equipments, especially to employees so they can continue working, giving financial and material assistance, as well as taking care of employees' mental health and engagement. So innovations in communications can be really of value to HR practitioners during crisis, knowing what is relevant, no, to their audience, how the message is communicated, and what means are used to communicate the message are all important facets in innovating communication strategies to maintain connectivity with all employees, regardless of whether they are working in their homes or in the office. This is an important learning that HR practitioners need to carry with them, no, as we anticipate and prepare for the next normal. And this goes with the need, no, to continuously embrace also yung mga technological shifts and to review, update, create business continuity and sustainability plans that considers unprecedented crises such as the COVID-19 pandemic. So thank you for listening, and we would like to thank the University Research Council and the School of Social Sciences Research Council and the SOSS Dean's Office, of course, for supporting two of the studies presented today, and also CORD's initiatives to understand transitions and transformations in Philippine workplaces that were experienced by Filipino employees and managers during the pandemic. Maraming salamat.
Thank you, Ma'am Joy. Thank you, everyone, for presenting today. I'd like everyone to give all our presenters a round of applause. Thank you, everyone. And I am now opening the floor to questions from people in the crowd. If anyone is brave enough to unmute themselves, talk to us, ask us any questions about any of the papers we presented today, I'll give you a few seconds. All right, so it doesn't seem like we have brave people here. So I will take a look at the list that I was given earlier today for questions. So, Sir Errol, this question is for you. I want to know if you've seen any striking differences in JDR in Filipino and Western populations, or at least other Asian populations.
Obviously, when we did the research, we did not naman outright compare between the West and the East. No, we did not do that. But it was very striking that in terms of the results, very strong yung pagiging guide, gabay ng leader. No? The collectivist cultural facet was really, really strong. This reminds me actually of one study that we did before with Dr. Jean Echanova regarding the concept of pakikisama. No, that when you go through a particular change initiative in an organization, no, kasama pala si Dr. Sara Elirenco of Ateneo de Naga, before I forget, that the concept of pakikisama is very, very important in times of crisis, in times of change. So probably, I'm not saying that in the West, wala nun. Probably it's much highlighted, no, in the study in the Philippine context. So the idea that as we go through the change, as we go through the crisis, my leader does not leave anyone behind. You know, he or she will be there to take care of us, to see how we are doing, and that he or she is monitoring our progress as we go through. So in terms of comparison, probably that's one thing that's very highlighted, yung pakikisama, yung idea that the leader will always be there through the challenges.
Okay, sir. Thank you. Sorry. Thank you, sir, for talking to us about pakikisama and how it makes our Filipino culture different. Do we have any other questions? Okay, so I think we'll go to the list again. Sir Wine, this question is for you. They'd like to know if there are any differences between sex or gender expression in the sample that we looked at.
Oh, yeah. Well, RM, we didn't really look at the gender differences yet, but I think it's something that we can look into for our next project.
Okay, sir. Thank you. This next question, I think, is for Ma'am Tony. Can you talk to us about any measures that private organizations can do to help support our OFWs that might have arose from our study? Now you can. Sige, ma'am, ako na.
Okay there. Okay, thank you, RM. Because when you talk about the private organizations, meaning you're referring to the employers themselves, for instance, tama ba yun? Oo, not the government naman, di ba? Okay. One of the programs that we were able to pilot also, and ito tungkol din ito sa job loss, ano? And our participants came from an organization here in the Philippines na medyo massive din yung naging job loss nila. No? And I'm referring to the Katatagan program. No? So if any of our participants, our how do I call them? Our fellow faculty members here in the room, no, ay familiar po dito, no. This is a program created by the Psychological Association of the Philippines, no, in cooperation with our some of our faculty members from the psychology department. No? Ito kasi this is a series of modules, no, and the goal is really to build the resilience of no, the participants. No? So as I've mentioned, na-try namin ito sa isang organization na pareho yung naging experience, no? Job loss din. Okay? Had nothing to do with the pandemic, pero yun din, medyo sudden din siya. No? And what's good about this program is, no, and regardless of the type of OFWs, no, okay, seafarer yan or mga iba pang klaseng trabaho, ang maganda dito kasi, the modules are what do you call that, are taught in such a way, no, na meron siyang psychological flow, no? They cover the different aspects of well-being, of resilience, no? And also, ang maganda rin dito is hindi ito considered as like a reactive kind of program, no? This can be something na organizations can put, no, into their mental health and well-being programs in general. Kasi it's a resilience program. So hindi siya kailangan about job loss, hindi siya kailangan about emergency situations. It can be, you know, about their everyday lives. And from these programs, no, matututo sila about how to problem solve, no, how to do mindfulness exercises to take care of their bodies, how to also think about mga meaningful activities, no, to recognize the resources that they can rely on. No? So yun kayo maganda sa ganitong programa. This is something na even, no, within the organization, they can tap facilitators. Of course, they have to undergo the necessary training, pero hindi ito kailangan maging costly. No? Kasi when you talk about programs that will build resilience or that will address certain concerns, no, many organizations fear na, naku, that will cost us a lot of money. And when you talk about the pandemic, parang wala na halos pera ang mga organization. Kasi nasa ano sila, no, parang nasa response doon sa pandemya itself, no. So paano pa kung magastos, no? So meron tayong mga paraan para mag-introduce ng programs that will not be very costly, will just require that members of the organizations themselves undergo training, and once they are properly equipped with the skills, no, they can already launch that, no? So maraming pwedeng gawin. Thank you, RM.
Thank you, Ma'am Tony. This is a follow-up question from what you just discussed. We have a question here talking to us about how the newly established Department of Migrant Workers, how can this department help mitigate existing challenges of OFWs and organize various OFW programs? For our information, the Department of Migrant Workers came into reality on 2019, and they are the overall head of OWA, POEA, and all the other different sub-departments like Migrant Workers Resource Center, Maritime Industry Council, and the Commission of Filipino Overseas. So the question is, what government programs would help OFWs under this department? Nakamute ka, Olima. Okay.
Yeah. You're asking me, RM, ako ba, Tony?
Yes, ma'am, Tony.
Oo. So yung the what do you call that? The organization you're talking about is?
The Department of Migrant Workers. They're the overall umbrella organization from the government.
So paano sila makakatulong?
Yes po.
Oo. Actually, when you look at the website, ano, sa atin palang Department of Labor or sa ano, ang dami ng programa in place, no? And I think also when you talk about the other organizations, meron silang mga na-conceptualize na on repatriation programs, no, on giving aid, on giving educational support, no, in terms of yung mga tuition fees ng mga anak ng OFWs, no. I think there are already a lot of programs na sinasabi nilang in place. Now, the challenge is, no, I think because of the pandemic, no, pwedeng kasi nga all were working from home or majority were working from home, no. So parang paano ito na-implement, no? Paano ba ito pinagana? Kasi nga parang we have to reconcile the fact na when you take a look at the website, no, there are a lot, no. Balik Pinay program, marami dyan, no? yung mga sa physical health, how to teach them na yung mga what do you call that, putting up businesses, ang dami. No? But we have to reconcile that with what the OFW said na parang, bakit pagbalik namin? Bakit parang wala? No? So, I don't think it's a matter of what new programs or what programs should be introduced or how they can help. I think it's really strengthening, no, what they already have. Kasi I'm sure meron yan. I don't think, I refuse to believe that there are no programs in place. Imposible yan eh, no? Hindi natin gagawin sa OFW natin yan. Pero how organized is it, no? Who is really going to take charge, no? And regardless of the situation, no, whether it's a new pandemic that will come along, a new crisis, yung continuity of the delivery of the services, I think that's what's more important. So if organizations, whether private or government, no, will have mechanisms in place para tuloy-tuloy ito, mas yan yung importante. Para we don't, receive reports from certain groups na walang aid, and then others will say, hindi, meron. So parang, bakit ganun? No, kailangan nating ma-reconcile yung mga bagay na yan. So as something that's going to be systematic and organized. So also, I think OFWs need to know that there are such programs in place. So how familiar are they with these programs? Para alam na when they come back, I can rely on such and such. I can go to this department. I can talk to this person. And I will be assured that the support will be coming when I need it the most. There. Hope I was able to answer that question. If anyone from my other colleagues, my other co-authors in the group would like to add something, please go ahead.
Thank you, ma'am. Thank you po. I will also add because you said your co-authors. Then, I would just like to echo what Ma'am Tony is saying, that while there are already programs that are in place that help OFWs, I think the problem right now is implementation, especially, and streamlining it, because we do know that there are a lot of different departments for migrant workers and OFWs, and there's a lot of confusion of where to go to get which help you need. So implementation and streamlining of the processes would be the best thing for our OFW. We only have time for one more question po, and I think this is a question directed to Ma'am Joy. Our participant would like to ask why phenomenology was the research method used in the study.
Yes, thank you. Thank you for that question. Alam nyo, in 2020, an article in The Economist came out saying this. The COVID-19 pandemic presents a different challenge and highlights the role of another corporate function, often unfairly dismissed as soft. So HR is looked at as a soft function within organizations, support function kasi siya. Never before have more firms needed a hard-headed HR boss. The duties of chief people officers as human resource heads are sometimes told, look critical right now. That's what The Economist said. They must keep employees healthy, maintain their morale, oversee a vast remote working experiment, and as firms retrench, consider whether, when, and how to lay workers off. So there was an emergent phenomenon pertaining to the evolution or how the HR function was evolving, particularly at the emergent phase of the pandemic. And I think up to now, as we are transitioning hopefully to the next normal. So we want to be able to capture the experiences of that particular phenomenon by the HR practitioners from their own perspective. And I think, and I hope that you saw in the presentation how that navigation of their experiences using the phenomenological lens was able to really surface the challenges that they helped address, how important the role of HR was in that transformation processes and phase that organizations and employees went through because of this pandemic. And I hope that will continue, that value given to the HR function will continue in the coming phases of this pandemic, and even beyond that, as we really try to beef up our capacity, to face another unprecedented crisis like COVID. I hope I was able to answer the question. Thank you.
Right. Well, thank you, Ma'am Joy, Sir Tony, Ma'am Tony, Sir Errol, Sir Wine, and Mikey. Thank you for your active participation in our session and presenting our papers. At this point, I'd like to present to you the certificates of presentation to our presenters. Allow me to read the contents. So the School of Social Sciences of the Ateneo de Manila University awards the Certificate of Participation to Dr. Menjola Tencaleja, Dr. Emerald J. Ilac, Dr. Tony Rose Mactal, Dr. Erwine De La Paz, and Mikey Talamayan as paper presenters for your invaluable contribution during the 4th School of Social Sciences Research Conference with the theme Transitions, Transformations, and Transdisciplinarity, Doing Social Sciences in the Time of Disruptions and Accelerating Planetary Changes, held today, April 18, via Zoom. We're giving the certificate to you on the 18th day of April 2022 in the Quezon City, Philippines. This certificate is signed by Dr. Alfred Pavlik, the coordinator for research in the School of Social Sciences of Ateneo de Manila University, and Dr. Sarina Saloma Akpedonu, the Dean of the Social Sciences. Thank you, and the certificate will be given to you by email after the conference conference proper. Thank you again, everyone, and congratulations to all our presenters.
Thank you. Thank you also,
Thank
RM, for
you.
moderating.
For sure. I'd like to address our participants. So we have an evaluation form. You can use the QR code. Someone will be sending it in the chat box. And we would be using this as a basis for tracking your participation in our conference. Only participants who are able to attend 3 sessions will be getting a certificate of attendance. So again, thank you. This ends day 1 of our 4th SOSS Research Conference. Thank you very much for joining us today. A reminder, if you're joining us tomorrow and on Wednesday, there's only one link for all 3 days of the conference. It was sent to you in your email, and if you can't find it, you can ask our tech support for the proper link for the day. Please take time to answer the evaluation so that we can send you your certificate of attendance. The link for and the QR code for the day 1 evaluations are on the screen right now. And thank you. We hope to see everyone tomorrow. Right. Have a good afternoon.
Recording stopped.